pray. Almighty God, who in your wisdom and goodness have appointed the officers of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants whom you have been pleased to call the performance of important trust in this republic. Let your blessings descend upon us here assembled, and grant that we treat and consider all matters that shall come under deliberation in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interests you have committed to our church. Amen. Before we start, honorable members, I've noted that the public gallery is a honorable member. I want to ask the honorable member to enter the chamber. Kindly find a tie and come to the chamber. I've just asked, and it is out of order for a honorable member to sit on the public gallery. Thank you. Yes, clerk.
Number 1, administration of oath. Order number 2, communication from the chair.
Thank you very much. With us in this chamber today, honorable members, I can see we have the CEC in charge of health, Honorable Dr. Situnik. We have CDH, that is Dr. Sawik, Dr. Kibet, that is the METSUP at the Speaker's Gallery, Bernard Tegay, who is the HAO, and Dr. Charles, in charge of public health. Honorable member, as per the standing orders and also as per our order paper, they'll have their time at the 7th order. So for now, you'll bear with us, we'll finish the business and proceed. Honorable members, I have received communication from His Excellency the Governor, Honorable Professor Hilary Barchok. The letter reads, nominees for the position of County Executive Committee members. The above subject matter refers, in exercise of the authority vested in me by the Constitution of Kenya, 2010, and pursuant to sections 35, that is appointment of the County Executive Committee members, on the County Governments Act 2012, Hilary Barchok, Governor BOMET County, wishes and has forwarded the following nominees for vetting by the County Assembly of BOMET for the position of County Executive Committee members. 1, he has nominated Justus Minor of ID number 20510139 to the position of CEC, Administration, Public Service, and Special Programs. 2, he has nominated Honorable Ambrose Kipkemoi Koech of ID number 1365030 and has nominated to the position of CEC Roads, Public Works, and Transport. 3rd one, he has nominated Honorable Ngeno Bernard Kipkorir of ID number 25805157 to the position of CEC Economic Planning, Finance, and ICT. Attached herewith are the CVs and other testimonials for the necessary action of the Assembly. That's a communication from His Excellency the Governor, and this is committed to Appointments Committee. Thank you very much. We will proceed with the orders of the day. Clerk.
Order number 3, messages. Order number 4, petitions. Order number 5, papers. Order number 6, notices of motions. Order number 7, questions and statements.
Thank you very much. Are the questions and statements? Questions which are due for today. 1, question sought by Honorable Josephat Kipkirui from the Chairperson Committee on Health and Sanitation regarding the status of health facilities in BOMET County. The member wished the Chairperson to indicate 1, the number, workstation, and payment of casual workers who are engaged under the Linda Mama program. B, the cash transfer. Is this the question for today? Honorable?
Yes.
You wish to ask this question?
The Speaker, that was a question I asked some times back.
You had asked some time back?
Oh, yeah.
So you are expecting the same from the Chair?
Yes.
Okay, I'll continue to read through. Chair Health, I hope you have the report for this. B, the cash transfer that were made to the various health facilities, including but not limited to the amount the health facility and the date during which those transfers were made. C, the utilization of the development budget by the department during the financial year 2023-2024. This should include the projects undertaken and their status of completion. D, the reason why most low-level health facilities lack medical supplies, despite records showing that substantial amounts have been on the same. E, the total cost and schedule of medical supplies to the various facilities during the financial year 30th June 2024. The measures that the department has undertaken to ensure a consistent supply of medical drugs to our health facilities. The measures that have been put in place to ensure that previous balances of medical supplies are delivered to the respective facilities. H, whether the department makes orders from other agencies other than KEMSA. You can come in, honorable members. The reasons for the delayed implementation of Facility Improvement Fund, FIF program. Additionally, state the reason why FIF regulation have not been forwarded to the County Assembly for approval. The fates of the recently promoted facilities in terms of quantities of medical supplies and the remittance of AIE fund. And lastly, the measures that the department has put in place to ensure timely and effective reporting by the community health promoters. I believe the chair will give these reports. However, members, as I promised you earlier, and as asked by Honorable Josephat before, there are questions which have been asked but have not been answered. I think one statement was asked by Honorable Vincent Mutai on 5th November 2024 from the Chairperson Committee on Finance, Economic Planning concerning contracts awarded to the following companies by the County Government of BOMET within the last 5 years. Giljet Enterprises, Rosina Building Contractors, Base Road Company Limited, Akbar Road, Consult Limited, Pay Solutions Limited, Santa Fe Solution. In response, the chair should state in response, the chairperson should state the specific contracts undertaken by each of the said company in the last 5 years, status of each contract awarded to each of the companies over the said period, whether procurement laws were followed in the award of contracts to each of the listed companies, and if yes, avail supporting documentation. And lastly, amounts of money paid to each company over the said period. On 17 September 2024, Honorable Dancel Kirui sought a statement from the Chairperson Committee on Administration, Legal Affairs and Citizen Engagement. The Honorable Member wanted to be furnished with the expenditure report for the County Legal Office for the financial year 2023-2024 and the first quarter for the financial year 2024-2025. 3. Comprehensive statement was sought by Honorable Roslyn Chepto on 24 September 2024, pursuant to the provisions of Standing Order 43 of the County Assembly Standing Orders regarding the implementation of BOMET County Facilities Improvement Fund and its accompanying policy. Specifically, she wanted the Chairperson Committee on Health and Sanitation to inform her on the following concerns. Why, despite health facilities across the county complying with the FIF Act and policy by recruiting essential staff, such as procurement officers and accountants, and preparing work plans for the financial year 2024-2025, the acting county executive member for finance and economic planning is now demanding that the funds be generated by these hospitals be remitted to the county treasury. Our question is why? B. Why is the acting CECM in charge of finance citing the absence of regulations as the reason for this directive, even though the health facilities have already developed annual development plans and financial projections and taken other necessary steps to operationalize the FIF in accordance with the law and policy? C. What justifies the directive from the acting county executive committee member for finance and economic planning to the control of the funds, given that the hospitals have complied with the legislative requirements and have already taken significant steps to implement the FIF? What measures are being put in place to ensure that the funds collected by health facilities remain under their management, as originally envisaged and intended by the Assembly when passing the FIF Act, so that they can continue supporting service delivery even in the absence of specific regulations? On 30th August 2024, Honorable Josephat Kipkirui sought a comprehensive statement from the Committee on Administration, Legal Affairs and Citizen Engagement concerning the delay in the submission of nominees by the County Public Service Board. As this Assembly is aware, the process for the nomination and appointment of members to the County Public Service Board is governed by Section 58A of the County Governments Act 2012 as amended by Act Number 11 of 2020. The law is explicit in its requirements and timelines as follows. Subsection 1 requires the Governor to nominate and, with the approval of this Assembly, appoint members of the selection panel whenever a vacancy arises in the County Public Service Board. B. Subsection 5 mandates the selection panel to invite applications from qualified persons within 7 days of convening its first meeting. Subsection 6 requires the selection panel to consider applications, shortlist, interview candidates, and submit the names of qualified applicants to the Governor within 7 days of receiving the applications. Subsection 7 stipulates that the Governor shall, within 7 days of receiving the names from the selection panel, nominate individuals for the positions and forward their names to this Assembly for approval. Subsection 8 provides the Assembly with 21 days to consider and either approve or reject the nominees submitted by the Governor. Subsection 16 allows the governor to extend any of the periods specified in the section by a period not exceeding 14 days. Despite these clear provisions, it has been nearly 2 months since this assembly approved the members of the selection panel, and yet no nominees have been forwarded to the assembly for consideration. This delay exceeds the statutory timelines, even considering the possibility of 14-day extension as allowed under the law. In light of the situation, he was requesting Committee on Administration, Legal Affairs and Citizen Engagement to investigate the matter and provide a detailed statement to the Assembly addressing the following concerns. Reasons for the delay in submitting the names of the nominees for the County Public Service Board to the County Assembly as per the requirements of Section 58A of the County Governments Act. Whether the selection panel has fulfilled its mandate within the timeline stipulated by law, including inviting applications, shortlisting, and submitting names of the governor as required by Section 5 and 6 of Section 58A. The actions taken by the County Executive Committee to expedite this process, particularly in ensuring adherence to the statutory timelines outlined in subsection 7 of Section 58. Another statement was sought by Honorable Joshua Kirui again on 7th of August 2024 from Chairperson Health and Sanitation, and I believe that is what I've read today. The chairs of the said committees, do you have your responses? Chairperson, Finance and Economic Planning, do you have the response from?
I have not responded, Honorable Speaker.
When do you envisage to kindly, Honorable Member?
I made a call yesterday and she told me that they are working on it. So they were requesting for extension of time.
Kindly expedite. Should get the response within the next 2 weeks. There was a statement that was sought by Honorable Dancel Kirui. It was directed to Committee on Administration, Legal Affairs and Citizen Engagement. Chair, the Committee on Administration, Legal Affairs and Citizen Engagement. Do you have a response to this question?
Thank you, Mr. Speaker. I have got no response, but still I urge to be given 2 weeks so that I can actually present.
Granted. The third question was by Honorable Roslyn Chepto, and it was directed, so it was committed to Chair Health.
Honorable Speaker, I think it is part of the response from the CC today.
Okay. Thank you. There was another question to Committee on Administration, Legal Affairs and Citizen Engagement. I believe these two members, they've been sworn in. So this is overtaken by events. All right. So at this point, honorable members, we will proceed to welcome the CECM in charge of medical services, Honorable Joseph Sitoni.
Point of order, Mr. Speaker.
What is your point of order, Honorable?
Mr. Speaker, I have a statement to make so that maybe if,
after that,
the CEC is in position to respond to some of them, then he can go ahead and respond.
You will give your statement. However, we need to give them time to respond, as is the norm, or allow you to read the statement.
Mr. Speaker, before the statement rests, we need also to guide this out, Mr. Speaker, because as per the calendar, we are about to go for a long recess.
Yes.
And I'm seeing that I heard that you granted the honorable member chairing administration to report back in 2 weeks' time, Mr. Speaker. Will it be
I told them to have the reports
in 2 weeks' time? Okay.
Yes. When we resume back, we will look into that.
Okay, thank you for your guidance.
Honorable Felody, come in. Proceed, Honorable Ernest.
Thank you very much, Mr. Speaker. I rise to seek a comprehensive statement from the Chairperson, Committee on Health, and Sanitation concerning the general status of health facilities in BOMET County. This has been necessitated by the recent incidences of loss of lives in our county health facilities, including but not limited to the loss of life of one Mrs. Damaris while giving birth in Cheptalal Sub-County Hospital. In the statement, the chairperson should indicate, 1, the circumstances that led to the unfortunate demise of Ms. Damaris while giving birth in Cheptalal Sub-County Hospital. 2, whether the personnel manning our county and sub-county hospitals, ranging from the administrative heads, are competent to run the stated facilities. Kindly provide the qualifications of each of the administrative aid of the county and sub-county hospitals in the county. Number 3, the adequacy and availability of drugs and medical services in the county and sub-county hospitals. 4, the referral protocols in our county referral and sub-county hospitals, including the personnel involved in the referral procedure. 5, the facilitation of the personnel serving in the ambulance services and maintenance of the ambulances serving in the county and sub-county hospitals. 6, the expenditure reports of the Department of Medical Services for the month of July to date, July 2024 to date. I beg to lay, Mr. Speaker.
Proceed, Honorable Ernest. Thank you very much. I think your question, since the CEC is here, the chair for health, I think you have 14 days to get a response from the CEC who is here. But if he has answers on it, then he can give us what he has now.
Point of order, Mr. Speaker.
Yes.
I want to ask the chair, you, Mr. Speaker, to treat it as urgent because the incident happened just the other day. So I would seek that the information be given urgently.
Oh, 7 days then. I think 7 days is adequate.
Point of order, Mr. Speaker.
Honorable Speaker.
What is your point of order, Honorable Bernard?
I would like to seek if we could have some supplementary question, Mr. Speaker, because we are fortunate we have CC with us. So some of the supplementary question, if you can allow us, will be okay.
Well, you might be having supplementary questions, but remember we've invited the CEC specifically for a question or a statement that has been thought before.
But Mr. Speaker,
we'll have the supplementary questions, but they will be answered with the ones that are given 7 days. Okay?
Yeah.
You have those questions with you?
Yeah, I have, especially also last week we raised some statement, Mr. Speaker, of which I was expecting you to be part of the answers we are expecting from CC.
You had sought a question from Chair.
Yes.
Which question is that? Because what I have were the questions that had been sought earlier, up to date.
Up to date. When you had a special sitting, Mr. Speaker, I raised some statement.
Let me inquire with the clerk. Then.
Mr. Speaker, the question was committed to Committee on Health, and you had given us around 14 days to bring back the report, and the chair had said that it is already
ready.
Ready, and I believe because the CC is with us, maybe it will be part of what the honourable member had raised. But if not, the report is with us, Mr. Speaker.
Okay. Honourable Bernard.
Also some clarification, Mr. Speaker.
Clarification from you. Do you want to make to have a new question, or you have the question already?
The supplementary question.
Where is that supplementary question?
All right, in due time I'll give Mr. Speaker.
Okay.
Also some clarification, Mr. Speaker. There is what Honorable Ernest has raised, especially on the status of our sub-county hospital. I'm standing here, Mr. Speaker, on behalf of the people of Kiambu, especially the Gas sub-county hospital, which I don't know if it's an health center or a sub-county hospital, Mr. Speaker.
Honorable Speaker, points of...
What is your...
Honorable Speaker, let me just thank this day because we have our CC. I think for the question which Honorable Kipkemo has raised, I think this because of the presence of the CC, he can give us a brief on what is going on now, because that is an urgent issue which I know the CC is having some maybe progress on the same. So you can allow maybe after the questions which was in the other paper or in was due for today, he can also put as a supplementary after, so that he can give at least a brief on it. Because we are going for the long recess and it is something urgent. So maybe CC can give
I don't
after.
know whether, so I don't know whether he has adequate time to respond to those questions that have been raised. However, and remember, given the questions he's just had, is it enough for him to answer everything? Maybe we can share the...
Saying those which he can answer.
The one he can answer.
Yeah,
Did you write those? Did you write down, Honorable CC? Thank you. So, honorable members who are starting, kindly come in. At this point, if anybody has a supplementary question, you can jot it down so that the CC can be given. He will get time to answer us in due course. I believe we'll have another sitting in the next coming few days. I realize that I committed to Appointments Committee and I did not give a timeline. Appointments Committee, you have 3 weeks to finish up your reports on the CCs. It should be within this house, within that period. Without much ado, I will allow the CC and his team to address the questions that had been sought by the honorable members in this chamber. On behalf of the whole assembly, we welcome you and your team to this august house. We have limited time. I can see it is 15:09. We have less than 20 minutes to make up your statement. Thank you.
Point of order, Honorable Speaker.
What's your point of order, Honorable Chichi?
Until the Honorable member spoke, I had not consulted the County Assembly calendar.
Yes.
I've read it, Mr. Speaker, and pursuant to Standing Order 197, subsection 2, and 199, clause number 4. There is a vocabulary there that says the calendar year. I've also consulted my dictionary, and it says calendar year is a period between December 1st and, January 1st and December 31st. When you look at 199, clause number 4, Mr. Speaker, it says that the County Budget and Appropriations Committee constituted by the County Assembly immediately following the general election shall serve for a period of 3 years, 3 calendar years, and that constituted thereafter shall serve for the remainder of the County Assembly term. Mr. Speaker, because we are going for the long recess, I think we require another communication from the chair directing the selection committee to reconstitute, because the 3 calendar years are over, Mr. Speaker. Now that we are going for the long recess and we need to come back when the House is fully constituted, we have a lot of business that is that should be.
Honorable Peter Rono,
Mr. Speaker.
You mentioned which committees?
PSC, PIC, and Budget and Appropriation. They are supposed to serve for 3 calendar years, and it has already lapsed. Now that we will be breaking today for the long recess, by the time we resume, there should be new persons in the same committees, Mr. Speaker. 197, section 2, and 199, clause number 4.
I hope the placard's noted. I'll give direction on that.
Honorable Speaker, Honorable Peter has mentioned 3 calendar years. I think we have only done 2 years, Honorable Speaker. Maybe you will clarify that.
All right, I'll clarify that. Thank you very much. As you know, as per the standing orders, there are committees we change annually. Also, the House business is annual. Every year it changes, so, but I'll give direction on that later. Honorable Switonik, floor is yours.
Thank you.
Is it working? Someone from the... Give it a minute. Somebody will sort out.
It's working. Yeah, thank you. Right, Honorable Speaker, members, Honorable members. This is a response to the comprehensive statement requested on the 31st July 2024 to my department. And number 1 was about the number, workstation, and payment of casual workers who were engaged under Linda Mama. Mr. Speaker, sir, during the rollout of facility improvement and SHIF, which is SHA, Social Health Insurance, the transition required that we mop up all the claims that were there for Linda Mama by various facilities. The Department of Finance, who are the custodians of this staff who work under Linda Mama or revenue collection, were deployed to assist with the mopping up of all the claims that we had. So these were not staff who were engaged by our department. They were just helping with the claims for Linda Mama. And so these are members of Finance Committee. We've since done a rationalization in our department, and we have casual workers who are engaged by the committees of the various facilities, and they range from watchmen, cleaners, and people who do groundwork, drivers, etc. And we do not have any members that we've deployed as a department. On the cash transfers, Honorable Speaker, question 2, the cash transfers that were made to various facilities, we provided a list of all the facilities that received cash transfers during that period. And I have a table showing that in the month of August 2023, we disbursed 67,303,000, and these include monies that were brought forward from March 2023, April 2023, and May 2023 up to June 2023. In September 2023, we disbursed 40 million, and this is for July 2023 and August 2023. In November, we disbursed 22,366,000. This is for September and October 2023. In December, same year, 2023, we disbursed 40,707,500 for October and November 2023. In January 2024, Honorable Speaker, we disbursed 33,123,000, and this is for December 2023 and part of January 2024. In February, we disbursed 1,770,000 for January disbursement, In March 2024, 26,929,290 was also disbursed for 2024 January. April, 129,000 was disbursed for January also. And in May 2024, 1,933,000 was also disbursed for January 2024, giving a total of 234,962 and 40 shillings. Honorable Speaker, the budgetary allocation for transfers to health facilities was insufficient to cover the requirement of for all the county facilities for the year 2023-2024. There was 4 months arrears brought forward as I've specified, and that was giving that total of 67 million, which was actually paid in August. In June 2024, we processed some money for county referral of Longisa amounting to 8,096,381, but it was not paid. I think the year closed before that. I want to specify, Honorable Speaker, that our transfers per month to all the facilities is 20,227,750, giving an annual figure of 242,733. But the budgetary allocation was 243,413,421 for that year. And our different facilities have different amounts that we disburse every month. For the county referral hospital, we disburse 8 million every month. For high volume facilities like in Danai, we give 1 million. Even the moderate ones like Sigor, we give 1 million a month. For the average, like Cheptalal, we give 750. For the low volume sub-county hospitals like Kapkoros, they are getting 350. High volume health centers like Sotik, they get 250,000. High volume health centers also like Chepchabas gets 210, but the medium ones like Mogokoshe, Koyua, Siongro, and Tegat, we give them 200,000 every month. There are low volume health centers, and a good number are places like Kiricha, Chebunyo, etc., and there are many. We give them 129,000 per month, and all dispensaries get 42,000 shillings a month. This is to cover for the overheads and engagement of additional staff, technical and non-technical staff. On question 3, utilization of the development budget of the department for year 2023-2024, including which projects were undertaken and their status of completion. I have also provided a list of all the facilities that we've utilized the funds or the budget for that year, the period under review, and these include Njerian, which is in Silibwet Ward. It's been completed. Kabiange, which is in Boito. Kamundugi, which is in Siongiroi. Kamundugi is a laboratory, and even Njerian is a laboratory. Segutiet maternity completion in Chesayan Ward is also complete. Tirgaga dispensary is a dispensary which is in Singorwet. Kabisimba laboratory in Siongiroi Ward. Tagaruto, and this was a pit latrine which is in Daraweta Ward, is also complete. Sito Tue dispensary completion in Chemaner. Keronjo dispensary which is in Kaplitundo. Danai sub-county hospital inpatient, which is in Danai Obosi. Kapkoros sub-county hospital, Cheleget dispensary, which is in Sigor Ward. Kapkoros is in Chesoen, and Chebos 2-year dispensary in Siongiroi Ward. I've attached the various amounts for each of those departments, and the remarks is the status of completion or ongoing. Specifically, Honorable Speaker, is that for Kapkoros and Danai, these are projects that at the time of reporting were 50% status of completion, but they have since gone above that. I've also included Cheleme, which is in Kipreres, Tegat, sub-county renovation, which is in Kembu, Kiblobotua in Kipreres, Sachoran, which was a pit latrine in Nyongores ward, Motiret dispensary, and these three from Sachora, Motiret, and Burgay were emergency construction of pit latrines because of the rains that were occurring at that time. Kimulot also was a pit latrine, which is in Kimulot ward. Saunet in Kongasis was a dispensary, and it's ongoing. Sugumerga dispensary, maternity completion in Sigar ward, and Kapkoros septic tank in Chesayan ward. The list includes also Masese dispensary in Singorwet, which is ongoing. Magimeny Health Center, which has been completed, and this was just putting up of a kitchen. BOMET Health Center Wash Hub, which is in Silgwe Township. Kiricha Health Center, which had a septic tank and raised water tank, it's complete. Rongena Dispensary Laboratory, which is also complete. Kapkures Dispensary renovation and maternity wing construction of a septic tank and elevated tank is also ongoing. Kirimose Dispensary, which is in Mbamos ward, it's complete. Koimiret, a new dispensary because the earlier one collapsed, and this is also ongoing. The list includes Muyuek Dispensary, which is also ongoing, almost completion. Kapke Social Maternity is complete. Pesiobe is a new dispensary, is also ongoing. Mugango Septic Tank is complete. At that time it was ongoing, but currently it's complete. And then we have Kembu Dispensary Septic Tank. So we used a total of 109,143,625 for the development for these projects. From the list that are provided, Honorable Speaker, some of these projects ate into the budget of that financial year because they were ongoing at that time and had become pending bills. Question 4, reasons why most low-level health facilities lack medical supplies despite records showing that substantial amounts have been spent on the same. Our stock status, Honorable Speaker, and reports indicate that low-level facilities are stocked with basic health products appropriate for the appropriate level of care, that is level 2 and 3. However, we acknowledge that a few of these facilities lack formulations for children, what we are calling pediatric formulation for children due to KEMSA supplies constraint at the time of delivery. At the time of the delivery, they did not have those supplies. Fortunately, this issue was addressed through what we call back orders. They give us a chance to get a second supply after the initial one is provided. And this was done for August. It was done on Friday, 2nd August 2024, for that, at that time when we were giving the answer. Additionally, several high-volume facilities, although operating at health center status on the ground, have been gazetted upon recommendation by the respective oversight organs, but were yet to be acknowledged by KEMSA. This is a disparity which we've tried correcting after a very long time, that in our levels we recognize a facility as a category, but KEMSA still has a lower level. But we've addressed that through gazettement and even in giving that information. And I'm very happy that the last supply, which we've not gotten, facilities like Chepchabas, which have been previously operating as health center, as dispensaries, have received drugs for the status that they are in. Number 5, Honorable Speaker, the total cost and schedule of medical supplies to various facilities during the financial year ending 30th June 2024. We have not provided the schedule, Honorable Speaker, because of the magnitude or the bulkiness of the information that is in those order papers that we use for ordering and receiving. But we are willing to provide soft copies of the same. But suffice to say that during that period, Honorable Speaker, the total expenditure for supplies was 239,164,862, which is for procuring pharmaceuticals and non-pharmaceuticals, including lab reagents. A total of 36,022,733 went to outstanding accounts that we have with KEMSA. But a substantial amount of this total of 239 million is actually what we pay KEMSA. The remainder of the amount is allocated to other suppliers who are contracted to deliver specialized renal, oncology, and lab reagents, because they are specialized and KEMSA does not provide those. Number 6, measures that my department has undertaken to ensure a constant supply of medical drugs to our facilities. We proactively ensure that timely supplies for health facilities is done. We have divided ordering into 4 quarters, emphasizing prompt submission to KEMSA, our orders to KEMSA, which is our primary source. For example, for quarter 1, 2024, we had initiated drug orders using the vote on account budget that we were allowed by this Honorable House. Facilities had actually by that time submitted their orders, which at that time were with KEMSA. So it is never a delay because of inability to order. We order in good time. We expect that at that time we were expecting that deliveries would come in August, and surely by August we received the additional the drugs that we requested. Apart from that, we engage KEMSA to improve on turnaround time. That means the time it takes for us to get our drugs, and the fill rate. That is the number of drugs that they pay us. I mean they send to us, and we ask them to give us our payment status. So we constantly engage with them with that, and it is very gratifying that even the last supply that we got, the time that it took for them to supply the drugs was shorter, and even the fill rate was close to 80%, which is a good achievement for that. And they did what we are calling the back order almost immediately. That means whatever we missed during the main supply, they came and we have since distributed to the facilities. Number 7, Honorable Speaker, the measures that have been put in place to ensure that previous balances of medical supplies are delivered to the respective facilities. As I've stated earlier, it is very difficult for KEMSA to give you 100% of their supplies, because as you order according to what they have. By the time they are bringing you your supply, because of the queue at KEMSA, some of the supplies will have been used for earlier people who came earlier than you. But they ensure that what we miss, we get the back orders. Or if we don't get those, if they don't have what they have, they give us what they cannot give, and we order that through other suppliers to supplement, and we distribute that. The only challenge has been that KEMSA gives what we call last mile distribution for the initial order. But for the second back order, they give us to be at the level of the sub-county. And to distribute drugs from the sub-county to the facilities has been hampered by sometimes we do not have fuel to ensure that we adequately supply these drugs. But these drugs eventually reach the facilities. Number 8, whether the department makes orders from other agencies other than KEMSA. And I've stated that we do make, especially if KEMSA does not have the supplies. Number 2, we also order for these specialized services or orders like lab and oncology, renal, which some of them KEMSA do not have. All these suppliers have been pre-qualified and they are within our procurement system. Number 9, the reasons for delayed implementation of Facility Improvement Fund Program. Facility Improvement Financing Act 2023 was assented to by His Excellency the President in October, 19th October 2023, and the commencement date for that act was 2nd December 2023. Section 29 of the Act provides that a county government may enact legislation to give further effect to the provisions of the Act in respective county. We understood that this would actually mean that we can use the national legislation for this FIF. The BOMET County Health Facility Improvement and Public Health Financing Policy 2023-2028 was formulated to provide framework for financing and improving health services at the county level. The policy recognizes the importance of investing in health infrastructure, workforce improvement, strengthening supply chain, and even promoting public health and prevention of diseases. And this would be, or this is actually what we aim to get by utilizing this fund. The goal of the policy is to provide a structured process by which health services are delivered in a safe, effective, and efficient, client-centered, and timely, equitable manner to the residents of BOMET and beyond. The policy actually of 2023 for BOMET was ratified by this Honorable House on 6 December 2023. The department commenced operationalization of FIF at the start of the year 2024-2025 on 1st July, and this involves sensitizing the health managers and in charges of the facilities. The department ensured that facilities have capacities to implement the FIF by providing capacity building guidelines and support personnel. The service charges for several health facilities in level 2 and 3 had not been provided for in Finance Act, and therefore the same has been proposed. At that time we had proposed for the 2024 finance, which was a bill at that time, to this county assembly. Longisa County Referral Hospital in Danai had already implemented FIF. The reduction, it is notable that the reduction of cash transfers to health facilities was from 243,413,421 in the year 2024 to currently 170,567,921 in this financial year, which is actually to be covered by the FIF. Currently, we have facilities that have asked for what they have collected and they are utilizing. A good example is Danai, Kapkoros, and even Cheptalal. Number 10, the fate of the recently promoted facilities in terms of quantities of medical supplies and remittance of AIE funds. It is of utmost importance that categorization levels are meticulously considered during the procurement and distribution of pharmaceuticals and non-pharmaceuticals. Unfortunately, in the past, some facilities have experienced supply shortage due to outdated categorization, which I explained that we've since regularized with KEMSA. And therefore, going forward, we will be getting what is due for actually the facilities. The implementation of FIF in the newly promoted health facilities and all other county health facilities will bridge the budget deficit for operation and maintenance, and we will be asking them that they can make their orders depending on their disease burden and whatever other commitments they have. So this FIF is coming in to really help. What is, and I request this House, is that Section 5 of the Facility Improvement Act, Section 5, Subsection 4 of the Facility Improvement Financing Act 2023 stipulates that the income and other receivables retained by the public health facilities shall be considered as a supplement to the budgets and resources appropriated to the public health facilities by the respective county government and not a substitute. So even though we are going the FIF way, it is prudent to continue helping the facilities to improve. And I believe at some stage when they will stabilize, then a gradual reduction in the monies that will be given to facilities can be initiated. Number 11, Honorable Speaker, the measures that the department has put in place to ensure timely and effective reporting by community health promoters, the newly recruited and engage CHPs. That is, I can only state that one of the things that we've done as a department is that we've received the gadgets that the national government has given. Initially, they gave us 1,929 because it was based on a pro rata to ensure that the total for the national government, the total for the country is 100,000. So we got 1929. But as we speak today, we have been given an additional 580 gadgets. So all our 2,460 community health promoters will get gadgets. The gadgets contain software which enables the health promoters to give reports on home visits, the referrals, and even the dispensing and investigations they do, including the interventions they do at the household level. So this is one measure that is done by the county government with the support of the national government. But apart from that, we've also done trainings for different cadres, including the people who supervise them, community health assistants who are called CHAS. And therefore, this is something that the county government has done so that we ensure that they report about our communities and what they do at the community level. The digital system that the CHPs use also include integration, or they integrate with other platforms that report on demographic data and management within the country, and that helps us to do follow-ups and even referrals. We've also passed the policy and this was ratified by this house, this honorable house, and that will help us to ensure that continuity of that service is well elaborated or continues even if the systems change. We also have a coordinating mechanism where in the county we have a focal person who is in charge of all the community health strategy, and that is cascaded to all the sub-county and even to the CHAS or community health assistants. So in collaboration with the national government and other implementing partners, the county has carried out training on the basic modules that are contained in those gadgets, and we continue to monitor their output. The payment even for these CHPs, although it has delayed, it is based on the assignment that they do, so that we don't have people who have gadgets and they don't visit the family. It is based on the output of their work. And in the next few days, we will be paying the arrears for the CHPs who had not gotten the drugs, their pay, including any work that the new ones that are getting the 500 new gadgets will have done. Mr. Speaker, sir, that is the reply to the questions that were asked on the 31st July 2024. Thank you.
Thank you very much, CEC, for your response on the question that had been raised earlier. However, there were other questions. There is one question which has been asked by Ernest. Do you have answers to that?
Honorable Speaker, the statement that was requested by Mheshimiwa from Kembu Ward reached our office and we have a response. I can proceed with that?
Please.
Yes. Honorable Speaker, this was a response to the Assembly, BOMET County Assembly, requesting a comprehensive statement concerning the incident which occurred at Longisa County Referral Hospital on 9th November 2024. Let me go straight to indicate that what happened. Because the first question was indicate the general condition of patients when they arrived at the hospital. On Saturday, 9th November 2024, 4 children aged between 3 and 5 were brought to Longisa County casualty unit with a history of bee sting injuries. The first 3 children arrived between 12 and 12:35. And this is verified even by our CCTV. And they were displaying distress, but was stable clinically enough to be treated and later discharged. Diana Chepngeno, the 4th child, arrived at approximately 1:40 p.m. in a more serious condition. She was reported to have been found unconscious in an napier grass plantation, exhibiting generalized body swelling, and our vital signs indicated a critical state needing immediate attention, and that was provided. Number 2, indicate the actions which casualty department personnel took to save the victim's life. In the immediate response, the first 3 children received prompt treatment for bee stings, including administration of medication and intravenous fluids, ensuring they are stabilized. 2 were discharged home. The 3rd child was recommended for temporary admission and observation. Upon Diana's arrival, emergency medication was also administered to her. Effort to establish intravenous access were made, and you could see from what she had in her hand, and monitoring of her vital signs were commenced immediately with emergency drug medication. Continuous monitoring and care. Diana was continuously monitored by medical staff. Medications were adjusted as needed, and multiple attempts were made to stabilize her condition. The staff consulted with senior medical personnel to provide best possible care because of severity of the condition. Number 3, indicate the circumstances which led to the referral of Diana Chepngeno to Tenwek Hospital for further medication. Despite intensive emergency care provided, Diana's condition suddenly deteriorated, necessitating a higher level care requirement. The decision to transfer Diana to a facility equipped with an ICU was made to ensure she received specialized care. Due to critical condition, it was actually deemed urgent. Number 4, indicate the condition of Diana Chepngeno when she was being transferred to Tenwek Hospital. At the time of the referral process, Diana had had an episode of coffee grounds vomitus. This is vomitus that is darkish, blackish in color, displaying signs of severe allergic reaction, including what is termed as anasaka or generalized body swelling. Her vitals indicated an unstable condition, which necessitated urgent specialized medication intervention that was beyond the capacity of our department our county referral at that time. Number 5, indicate actions that have been taken by Health Service Department to ensure that no other incident of such nature occurs in the hospital. An ad hoc committee, multidisciplinary advisory committee was constituted to investigate the incident and recommend measures. And the measures included ensuring that our facilities give comprehensive documentation for all patients' care activities that is essential for improving medical care. Number 2, enhancing communication between medical personnel and patients' families to strengthen relationships and ensure clarity in care of plans, care plans. Number 3, strict enforcement of referral procedures and protocols to ensure adherence to established guidelines, including considering guidelines that are given by the receiving facilities, because some of these facilities have their own requirement. Organizing is another measure is organizing continuous medical education and emergency response drills to foster regular training and preparedness among healthcare professionals. Number 6, enlist the actions that have been taken by the health department to ensure that other patients gain trust on the services rendered by the county health facilities. We have We have always enjoyed mutual trust with local community based on quality of services offered by facilities. There has actually been an upsurge of patients, including those from the neighboring and distant counties seeking help at our facilities. The influx of patients is actually due to confidence that they have and the quality and the range of service that we offer, despite the challenges that occasionally we have. Nearly half of our patients actually come from outside BOMET County. We have taken the following measures. And I've stated that there was an advisory by an ad hoc committee, and we've taken their suggestions to ensure that we improve the service. But we want to emphasize that we want to enhance effective communication in patient care. And this includes telling the patients and the relatives what our plans are and what are the challenges we have and what are the remedies that we may provide. We also want to continue providing improvement in protocols that we have, including new developments because of the changes in the systems that come with ICT. We also want to plan that we have a toll-free line. We have a line currently, but occasionally that is blocked because it also serves the hospital departments within. So a toll-free line would be what we want to emphasize, and that would be 24/7. And then an awareness campaign. We've realized that too many negative publicity has really hampered the kind of good work that our facilities have been offering. And one of the key things that we will want to do is awareness campaign, where we create open days for facilities so that they help us. And then, of course, exit and pilot programs where we can interview the patients who have come to receive, and they give us a feedback. We've established customer care desk, but we want to revamp it to include somebody who can do liaison between us and the people who come, especially in the county and the sub-county referral. And then, of course, do training so that people understand what it means to have customer care, because customer is everything when it comes to any transaction that you are offering a service. Number 7, state the kind of compensation that the county has given to the affected family. The county government waived the cost of treatment for all the children as part of National Clarion Call for free service for all children under 5. Additionally, the mortuary preservation fee were waived by the county government. The county executive, led by His Excellency the Governor and the county and the Honorable, Right Honorable County Assembly Speaker, visited the family and condoled, and we continue to condole with them. And there was some fundraising during the burial. Further details regarding support to the affected family have not been discussed, but should it arise, we will be ready to enter into discussions. Number 8, and the last, Honorable Speaker, provide a pathology report indicating the cause of death of that child, Diana Chepngeno. The autopsy report is pending finalization because this was done by a pathologist requested by the family. Once that is available, the report will be shared to relevant parties, including the Assembly if need be. In conclusion, the above comprehensive statement highlights the commitment of the Health Service Department to prevent further incidents, improve patient care, and enhance public trust in our health care system. That is our response, Honorable Speaker. Thank you.
Thank you very much, CC. There is a bottle of water in front of you. I know you've been talking for quite some time. Honorable members, I think the questions that had been asked have been sufficiently answered. However, I will allow 1 or 2 members to probably say something to the CEC before we leave. Remember, we have another CEC again in the next few. Now I'm expecting the majority leader, because time is not on our side, we need to have a procedural motion to extend time and allow us to finish the business at hand. I will urge the members who are in not to leave the chamber until we are done. We have a very important business ahead of us. And therefore, if any one of you has something to tell the CC and say, Chair, Bell.
Thank you, Honorable Speaker.
The three of you, after the Chair, then Honorable Josephat, and lastly, Honorable Peter.
Thank you, Honorable Speaker. Honorable Speaker, I want only to put some, maybe some review on this, on the answers. Honorable Speaker, on cash transfer to facilities.
Yes.
This cash transfer to facilities was reviewed in 2014. After now, we are still using the same amount, like the 42 to dispensaries, of which it is a small amount, which needs some review, because after now, the dispensaries are suffering because of the same. You know, the F5 are not being implemented in dispensaries. We need to review the cash transfer to those facilities. Even the level 1, level 2, the level 3, the 129, which has been mentioned, is still very little money in those cash transfer. Another thing, Honorable Speaker, is the implementation of the F5. Waziri says some of the facilities has taken up the implementation, but as I know, there is some which has not yet started, like the referral hospital and other sub-counties has not yet have stabilized the F5 implementation as by the law. Another thing is the ambulance management. Honorable Speaker, the ambulance is a problem in this county. We have the 4 ambulances which are moving around, but according to my own research, I'm seeing there are very few. We need to add more, maybe 3. But before that, the one which are going on, which we have in terms of fuel, the management of fuel in this ambulance, the management of coordinations from the facility to this ambulance, and maintenance. You find recently, the day before yesterday, we have a problem of just a battery in an ambulance. So we need to know the maintenance of this ambulance in our county. It seems as we don't have good management for these few ambulances we have. Thank you.
Thank you, Honorable Speaker, for this opportunity. I wish to thank the CC in charge of health and the officials for having appeared this afternoon in response of a raft of issues that I did ask on the 31st of July this year. Mr. Speaker, I must sincerely thank the CC for having made a decision despite the short notice to appear before this House. And I must also thank the Honorable House for having allowed or for having passed the motion that now allows the CCs to be able to give information before the House directly. Mr. Speaker, initially we've had challenges whereby we've asked for clarifications on issues, and it would take a lot of time. And again, Mr. Speaker, sometimes the information supplied was not sufficient. In this time, Mr. Speaker, we are making a step by having information supplied to the House so that we have a general information across the county. Mr. Speaker, I want to respond to a number of issues that have been. I want to really seek for to add more information on some of the clarifications that I sought on this statement. The Speaker, to begin with, I must state that the status of health in our county is very crucial, and we have to give all the support to the department in terms of resources allocation so that the health is improved across the county. As Speaker, I am very much concerned with the areas that are still outstanding to various facilities in form of AIE support that, Mr. Speaker, is impeding the service delivery in most of these facilities. And I want to urge the department to have a clear conversation with the finance department so that priority is given to the health department whenever there are exchequer releases. Mr. Speaker, whenever we have areas beyond or past 3 months, Mr. Speaker, it tells you that the workforce or the casuals that have been engaged in our facilities are no longer motivated to offer services to our people. And it is only prudent that the department have a conversation with the department so that they are given a priority in terms of remittances. Mr. Speaker, it is also a matter of concern that most of the facilities that were initially upgraded via a cassette notice are still maintaining the initial status. Those that were upgraded from the dispensary level to level to the health center status, Mr. Speaker, was still receiving capitations or AIs that are not matching their status. Mr. Speaker, I want to urge the departments that also they improve in terms of the amounts that they are giving to these facilities so that they are able to engage adequate staff and they are also able to acquire some of the necessities in those facilities. Mr. Speaker, with the emergence of the FIF fund, it is clear, Mr. Speaker, that the emergence of FIF fund should not be a substitute to the support that the county department has been offering to the facilities. Instead, it should be able to supplement, and I want to urge the department that they continuously provide support through AIs to the department, so to the facilities, Mr. Speaker, so that they are able to source some of the necessities and ensure that there is proper service delivery in those facilities. Mr. Speaker, another issue of concern is the CHPs that were engaged by the department, which I must urge the
point of order. Mr. Speaker, I'm not interfering with the honorable member, but question to allow me to restore motion before honorable member proceeds. Honorable Speaker, I would like to move the following respectful motion. That person shall be order 33A. This one assembly results to extend its sitting time within business appearing before appearing in the paragraph is dispensed with. The speaker is elected. I request honorable majority leader to thank you, Mr. Speaker. I support that this house until the business appearing is suspended.
Thank you very much, Majority Whip and Majority Leader. For bringing this to allow us to finish the business with the order paper. I therefore propose that first one to standing order 33A, this county assembly resolves to extend its sitting time until the business appearing in the order paper is dispensed with. Honourable members, the floor is open for debate on that. Fielding by the mood of the House, I will proceed to put the question that pursuant to standing order 33A, this county assembly resolves to extend its sitting time until the business appearing in the order paper is dispensed with. Honourable members, will as many as are of this opinion say aye? Aye. Will as many as are of the contrary opinion say nay? The ayes have it. Let's proceed. Honourable Josephat, kindly finish up what you have.
Thank you, Mr. Speaker, for the extension of time. Lastly, Mr. Speaker, the status of most of our health facilities, I must thank the department for having ensured that most of the facilities are being improved infrastructure-wise. But I will only want to put across this, Mr. Speaker, that let the complete status, Mr. Speaker, be that a facility that is operational, not a facility that has just been completed in terms of construction, Mr. Speaker, but it should be complete to the point that it's been commissioned for operation, so that we don't have most of the facilities having been completed still stalling after their completion in terms of infrastructure. Mr. Speaker, just like the chair on Health Committee has stated initially, there is need to review the amounts that are being channeled to these facilities, considering that the initial, the current figure that is being supplied or that is being channeled to facilities was done way back, I believe, in 2013. And 10 years down the line, we are still maintaining the same figures. I believe it is high time we do a review on this so that our facilities get a better allocation. Still, Mr. Speaker, I have noted with a lot of concern the differences that are being channeled to facilities of the same level. I've just seen that a guard which happens to be a sub-county hospital is receiving a pay that is of a health center status. Mr. Speaker, these are some of the issues that we are pleading with the department to review and ensure that there is consistency across facilities of the same level. Lastly, Mr. Speaker, there are some of the emerging issues that I want to point out. I want to ask the department, through the administration of Longisa County Referral Hospital, Mr. Speaker, the entrance to the morgue, Mr. Speaker, is in a wanting condition, and the health committee of this house needs to give us a report on the approach that they are using to ensure that that road, that access road to the morgue, is fixed in due course, Mr. Speaker. Otherwise, I want to thank the department for having given a report on this, and we want to ask our health workers, especially the medics, Mr. Speaker, to always be responsive to the health issues across the county, because there is somehow a perspective that people feel like there are no services in our facilities, yet they are there. I must ask these officials from the department to do a serious campaign, positive campaign for that matter, so that people are made aware that the lack or the unavailability of drugs is not unavailability of services in those particular hospitals. Mr. Speaker, we have been drawn to the attention of what happened in Cheptalal, and whoever has, the Speaker, failed in terms of response should be, Mr. Speaker, handled with should be given the treatment that he or she deserves, because we cannot afford really to lose lives where there is negligence by some of the workers, which to me, some of them appears to be sabotaging the work of the department. Otherwise, I must thank all the members for having always considered that there is adequate budgetary allocation in the health department. Thank you very much.
Thank you very much. Honorable Peter Rono.
Mr. Speaker, I want to, I promise to be very brief. As a follow-up, Mr. Speaker, I did listen to the Honorable Dr. Sitonik as he made his submissions regarding a question on the utilization of the development budget. Mr. Speaker, 2023-2024, or rather 2022-2023, that way, several projects that he mentioned are ongoing. And if you ask, because they are domiciled in the wards we represent, the problem lies in the staff of the department, including quantity surveyors that are domiciled in the Department of Roads. Mr. Speaker, you find a contractor who has been on site for several months. When you ask a question, he or she outlines that the problem is documentation. I want to ask the CEC to take it to the cabinet that they should discuss the conduct of young officers, or not only young officers, but junior officers who are supposed to facilitate technical progress of programs within the departments, especially the quantity surveyors. What is it that makes it hard for them to develop PQs on time? Because a project has been tendered for works, and the time it takes to commence is so big. Number two, Mr. Speaker, and the final one, is that this county assembly appropriates enough resources, monies to procure drugs. I'm also not convinced as such that what the CEC said here is the right position. Because when you go to the dispensaries and ask for the records of deliveries of drugs, they vary. You can receive drugs in January and the next consignment comes in June. I don't know the frequency, but if we have budgeted enough money to carry us throughout the financial year, then there should be order of deliveries. And I want to believe, I did hear the President and the former CS Health, Nagumija, saying that the procuring drugs only from KEMSA was not the order of the day. If it still stands, we should be informed. If the department is allowed to procure from other suppliers, then we should have prompt deliveries. Because I represent a ward that has several dispensaries. Every time I go to forums, I'm asked, where are the drugs? You know, the public there thinks that it's MCAs who give out drugs. Now that the real person is here, then he should take the responsibility and tell the public why there is delay of supply of drugs to the facilities. I beg to stop there, Mr. Speaker.
Mr. Speaker, I just wanted to, first to pass a message of condolence to the family of Damaris, who lost her life in Cheptalal Sub-County Hospital while she was giving birth. Mr. Speaker, it is so unfortunate that we lost life in Cheptalal Sub-County Hospital. And the reason for the loss of life, Mr. Speaker, is given that it is because the ambulance was not working. The information that the ambulance had no fuel, and also that it had no battery. Now that the CEC is here, Mr. Speaker, I would want to inquire from him whether he got information about what transpired in Cheptalal Sub-County Hospital. Mr. Speaker, we are very concerned that if the CEC is here and he cannot answer that which is in the public domain, it doesn't even require any further time. I think he can answer that. He informs this House of any preliminary report that he has, so that we get to know what is the plan. Because he has come here to respond on an issue that happened in Longisa, and before he even respond, there is another incident that has happened in the sub-county hospital in Konoin, Cheptalal, Mr. Speaker. So it will be in order, if you allow, Mr. Speaker, that the CEC informs this House as to what really happened and why are these incidences happening all the time in our hospitals. Mr. Speaker, I know the question that I asked, some of the information that I seek, that I sought, may require time. But on this one, of the death of Damaris, he needs to tell us, so that we don't need to be coming here, Mr. Speaker, when we receive bad news. And Mr. Speaker, I would even insist, I don't insist, Mr. Speaker, I'd request that you will give us an opportunity so that we stand in respect of the dead Damaris, because it happened in our sub-county hospital. Thank you very much, Mr. Speaker.
Honorable Speaker, one last one, Honorable Speaker.
I had said only 3, now you're adding another.
And one last one, a very positive one, Honorable
Then you are the last one.
Yes. And Honorable Speaker, allow me also to thank Honorable CC for his presence here, Honorable Speaker. And one question, Honorable Speaker, is that the national statistics shows that the enrollment on share is 12.7 million nationally. And BOMET County and Kericho County was registered as the lowest in all the counties, Honorable Speaker. So I just want to ask, what step has the department taken in ensuring that there is a county-wide registration of or enrollment of our residents in the SHIFT program, Honorable Speaker? I think that is the only one, Honorable Speaker. Otherwise, I want to urge the CC to maybe improve further on emergency protocol, Honorable Speaker. You should learn on the 4 R's of emergency, Honorable Speaker. Thank you.
Thank you very much. I think your question was very valid. Thank you. CC, you've heard the concerns of the members. It's a concern of everybody actually in this county. From what they've given, it looks like there is a systemic problem in your department. Right from simple issues like a battery. That's the same way the Honorable Member was mentioning. And other issues. I believe you've got to answer Honorable Bernard Langat, what he had requested earlier. You have 5 minutes to wrap up.
Honorable Chair, Honorable Speaker, sorry, I have at the onset to say we condole with the family of a lady who lost her life. I was informed on Tuesday about this occurrence, and it really hurt me so much for what happened. In the process of giving birth to life, someone lost life. As a preliminary measure, Honorable Speaker, I informed the Chair, Health Committee immediately of what had developed. And in the acute phase, when things are like that, it's always good to be close to the family as much as possible. So we visited Cheptalal Hospital together with the Honorable Member for Mbomos, and we were able to meet the family to condole with them, because at the onset, the reaction was not very favorable to us. And we put ourselves down to really condole with them. So we have a preliminary report. But I have a team today that went there to look at the details of what happened. What is puzzling, Honorable Speaker, is that a team did so well to deliver the baby. Good weight baby of a mother who had been attending clinics very well and had no issues. But immediately after delivering, they noticed that she was bleeding, and the bleeding was not stopping. We want to find out why it took time to even make that decision, and I have left it to a senior obstetrician in the county who is with a team, head of nursing department, together with the hospital, to really look at the clinical aspects of that. But it's unfortunate that despite getting to the level where the lady delivered well, her condition deteriorated suddenly, and she passed on. We've been having challenges with fuel, but yesterday we started getting fuel. So I promise that even for any other emergencies now, we will not have an issue with fuel until further notice, because we now have a plan with the FIF to ensure that each facility, especially the sub-county hospital, budgets an amount that's specifically meant for ambulances. So if a patient is starting from your hospital, they will be able to fuel. So we will be setting aside an amount for that. Number two, and I heard a member mention the issue of sabotage. What troubles us is that a day before, that same ambulance had taken a patient to Litei because there was a problem with the SHA, and the patient could not be seen at our facility in Cheptalan. How it ended up being a battery issue is a question. And even if it was a battery issue, where is the old battery? Because the issue is all these vehicles have batteries. So I've instructed that team to look at the details of what really happened. What I've noticed, as per my assessment, and the Honorable Chair for Health was there, is that at some stage, the escalation of information was not going to the higher level, it was going to the lower level, where drivers are consulting among themselves. We have agreed in the department that we are looking into this matter, and whoever lacked diligence in his or her duty will have to bear with the consequences. So we visited the hospital. We committed ourselves as a department to see how we can help that young man, because he is now a father and a mother of that baby. One of the immediate measures we've done is to give, there is some feed we give to children who do not have breast milk. And this afternoon I've talked to the county pharmacist so that we continue supplying additional feeds for this child. At some stage we discussed accommodation at home or at a baby home in Makokosiek or at the county referral hospital. Eventually, with the advice of the children's officer, we were told it is better to have the child in a hospital setting to observe. And we agreed that Longisa would be free, but the family, in the end of the day, said they want to take the baby home. If need be, and this is something that we will be requesting the support of the committee for Cheptalal. If need be, we can engage that young man to work at some pay as a contract staff, so that you can get something small to assist with the care of that patient, of that child. On the enrollment of SHA, I think the latest statistics, Honorable Speaker, shows that BOMET was actually leading. We've been at number 6, number 7 in terms of enrollment, but I think the last, which was done on 26th, BOMET County was at the top. And this is due to the good work given or done by the residents of BOMET with the support of our CHPs. I agree with what the members have said on review of what we give. These were historical allocations. And the departments or the cities have since improved in terms of the services they offer. And even Cheptalal itself, which was the first to do a cesarean section outside the county referral hospital, should actually be helped, and they have a theater. On the ambulance coordination, initially the coordination was that we didn't want people to hold on to the ambulances as if it doesn't belong to the county. But what we've done is that we will decentralize the location where they are, and with the issue of the funds that we'll be budgeting from the FIF, we anticipate that will be a smoother way of use of these ambulances. We've also said we will decentralize decision making, so that in case of, and I emphasize there, in case of a challenge, they escalate to us at whatever time, because we are there to serve Wananchi. I'm paid like everybody else for a service that I offer. Even at night, we will be ready. On collaboration with finance, I've taken that into note. Completed facilities, we intend to make sure they are operational and commissioned. And then we will look at the access road together with our gate at the county referral hospital. And then, of course, the publicity is what I had even mentioned in my earlier engagement. It is true that one of our biggest challenges is support from the QS and the engineers. They are either overburdened or it takes time to get this information. Otherwise, part of the delay, as rightly observed by a member is that it is what makes us not to have some of these things done in good time. Thank you, Honorable Speaker.
Thank you very much, CC, for your statement that you've given. However, this being not a debate, but a question that has been directed to you, I remember when you were giving your speech, you say the person who would be responsible, you will take action. In your report, I didn't hear you mention, have you taken, what happened in Longisa? Somebody was actually responsible for what happened. What steps have you taken on that? And again, from what happens in our county, it looks like the whole department of doctors here are reacting. When will some of you take responsibility for what happens? Because we are all these members here are seen by the public as if they are not doing anything. Yet the whole thing lies with you and nobody takes responsibility for it. Please answer that.
Yeah, Honorable Chair, Honorable Speaker, I agree with you. It's looking like we are reacting. But I want to appeal that part of this is because of the incidents. But if you look at what has happened in the department, there are so many good things that happen. And I mentioned in my earlier statement that we have very responsible staff. In fact, part of the work that you see me doing or assuming the role of doing is because of the support. So we have a very nicely unified team that works together. Occasionally there are challenges. And for the issue of Longisa, the regulatory bodies came around as part of the issue that we encountered. And we are waiting for their reports, because part of disciplinary action involves professional matters that the regulatory bodies will do. There was a team from the Nursing Council, a team from KMPDC, that is the one that regulates doctors and clinical officers, and there was a team from the Pharmacy and Poisons Board. We will get their recommendations and then take necessary action. But we've looked at the gaps, and we are meant to learn from those gaps. And I mentioned initially that part of the challenge that we noticed was the documentation and lack of the necessary infrastructure in terms of equipment. And we've moved ahead and gave recommendation to the medical superintendent to better equip that casualty. And in a few months, we'll be requesting support of the national government so that we get better equipment and have that casualty work as an entity on its own, to have its own X-ray, a laboratory, and all the units that are required for the casualty, so that we don't inconvenience patients rushing up and down. Thank you, Honorable Speaker.
Mr. Speaker, Mr. Speaker, you can just allow me to ask one question, Mr. Speaker.
Question time was done.
Just a question.
You want him to answer that again?
Yes.
Now, then it means we will not leave because time is sincerely, it's 16:30 and we still have business which is not finished. We still have one CEC to appear for us. Okay. Let it be the last one. You have one question also?
Right of reply, Mr. Speaker, because I was the one asking the question which was being raised by the CC.
You know, right of reply is him replying.
No, me to reply.
Unless you want to make us, we know we are wasting time. Eh? Why don't I say if you have a question, you can write it down?
Yes, Honorable Speaker. We had already written down supplementary questions.
Yes, so
I think we can have supplementary question written down so that they can be forwarded.
So that we can save on time.
Point of order, Mr. Speaker.
Maybe, Mr. Speaker.
Honorable Speaker, I'm a bit concerned that we seem to be treating the matter that is at hand by thinking that time is really against us while we are asking pertinent questions. I am concerned, Honorable Speaker, that we are not giving good time to honorable members to vent or even ventilate through the issues. I'm requesting through your guidance, Honorable Speaker, that you consider if time is really against us. No one is moving out of this county, not the CCs, not the MCs. Can we allocate more time so that we are able to discuss this matter fully? Because everyone else asks questions, and we want to hear it from the horse's mouth. And the CCs here. And honorable members, we don't want to look like we are in a rush to jump into conclusions. And some of us will always, like Honorable Peter here was asking me about the CHPs not being paid while they've been paid in Kericho County. They're asking why they've not digitized disbursement or even replenishment of drugs in the hospital. And you know, it's a question that we'd want the CC to answer. So, Honorable Speaker, through your guidance, can you allocate more time?
Actually, as per the tradition and what we said as a house, honorable member is allowed to come in once the question has been served to him at least 24 hours. You see, if we have questions, and that is what I've requested, if you have a question, have it in writing so that it can be given to him, he gives the response for it. Otherwise, we might ask our questions up to late at night. Yet we have another CEC who is yet to appear before this house. I don't know whether she is around. Has she appeared? Not yet. Now, I believe...
Maybe, Mr. Speaker, just a point of information, Mr. Speaker. I think, Mr. Speaker, this is a very important day for us, Mr. Speaker, to dispensate on what this county has undergone in the last 3 weeks, Mr. Speaker. And on top of that, Mr. Speaker, we still have another issue on the same. So that is why we are really requesting you to allow us just to inquire from the CC in charge, because I know our electorate are watching us, so that those questions which our electorate will be asking me in the crown are the one I'm asking the CC today, Mr. Speaker, and he can answer to them while they're at home, Mr. Speaker.
Just to save on time, I'm not cutting you. I want to know from Chair, Water, Energy and Sanitation. Any member from that committee? Get in touch with the CEC so we know whether we have enough time or not.
Honorable Speaker, I didn't hear your question. What is the direction?
In our order paper, she's supposed to appear just the same way Waziri is here, to answer on the question that was asked by Honorable Samuel. If she's not with us, then we might still have some few minutes to ask the questions. That's what I want to know, whether she's around or not. Okay, if she's not in, then continue, Honorable Richard.
Okay, Mr. Speaker, let me go straight to my question. Just to inquire from the CC in charge of health on the issue of community health promoters who are still unpaid up to date, Mr. Speaker, because they are claiming that they have received their due through the national government, but not yet received anything in the county government of BOMET. Number two, Mr. Speaker, I also want to know from the CEC the plans he has concerning the already completed dispensaries in various wards, one of them being Chemaner, as he has said, that we have one which is Itotwet dispensary which is already complete, because it is now almost 5 months after completion, and there is nothing going on there, Mr. Speaker. So I want to know from the CC if he has planned to open soon, because our people are asking why was it constructed and it is still being underutilized, Mr. Speaker. Finally, Mr. Speaker, I also want to know from the CC, even though he has touched on it, but not fully, Mr. Speaker, I want to know the plan he has on the incomplete projects in various wards, Mr. Speaker, being one of them is from Jemaner, that is Kimuchul Dispensary, which we have a pending a laboratory which has not been completed and is now almost 10 years or 8 years when it was started, constructed. Thank you very much, Mr. Speaker.
Chair Budget, you're leaving and you've asked a question. All right. Any other person who has a supplementary question?
Yes.
You read out the question for the sake of answer.
Okay. Thank you, Honorable Speaker, for having gotten this time. Let me ask some clarification, Mr. Speaker, because we have the CC with us today. I want to say it is unfortunate to find the same incident at Jebteral, which has happened also at Longisa. It put us wrong as a county, and especially our health sector. So, Mr. Speaker, these things need to be attended to urgently, because we should not be a county whereby we are only reacting for what has happened, especially when we say because we have lost the mother, we will give the job to the father. That is not a solution, because we will not be losing lives and then replacing with jobs. It will not work, Mr. Speaker, like that. Especially our people will be seeing us like a jokers. Mr. Speaker, there is this issue which Ernest and Honorable Ernest and Honorable Kirui as raised about the sub-county hospital, Mr. Speaker. I'm coming from a rural ward, Mr. Speaker. As we have a Longisa Referral Hospital, and it's high time we talk about Longisa Referral Hospital, Mr. Speaker. Our referral hospital, Mr. Speaker, Longisa, is not a sub-county hospital for BOMET East. It is a hospital for all county. It is a referral hospital. It is like level 5. And I want to ask the CC which is here, is there any point in time I've discussed as a department Longisa County Referral Hospital to stand on its own as autonomous? Because if we give Longisa Hospital its resources to stand on its own as autonomous, Mr. Speaker, its services will be improved. Some of these cases we are talking here, Longisa could be taking care of its own because they will have their own resources. If we will be still using Longisa Hospital as part of the putting under Department of Health in BOMET County, Mr. Speaker, we are wrong as this county assembly. We should prioritize budgeting county referral hospital as its own, apart from health department, so that we improve its services. So I'm asking, Mr. Speaker, if the CC in charge have come at a given point in time to discuss about making Longisa Referral Hospital as its autonomous. Because if we give a Longisa as autonomous, Mr. Speaker, its service will be improved. We should have its own isolated budget, different from the budget of health, because we want to improve the services of this county, Mr. Speaker. Another question, Mr. Speaker, I'm asking. For the last 2 months, Mr. Speaker, I've been seeing CC running to Kapkoros sub-county hospital. They are coming to the structure, going to Danai sub-county hospital. I've never seen coming to Tegat the same program, Mr. Speaker.
And if we want to reduce the number of backloads we are coming to Longisa, our sub-county hospital should be improved. Because some of the cases could be minor, could be sorted at a lower level, like Teka, Chiamaner, Kembu, and we reduce the workload of Longisa in terms of coming to waiting. Some of the cases will be finished at our lower level. So I'm requesting, let the department consider the sub-county hospital to its status. Especially Teka, we are giving like 200,000 monthly. A sub-county hospital is like an health center, Mr. Speaker. Or we people will be seeing us only giving a name and wasting its resources, which could be given to a better status. Another thing, Mr. Speaker, considering the amount we are putting in health department, Mr. Speaker, we are putting a lot of money. It's around 2 billion, Mr. Speaker. But when we see its procurement plan, Mr. Speaker, as stipulated in our budget, you find the end of the year, what we already put in procurement plan will not be done, or which it will make us as people who are not following what we have put in our work plan. I was hearing CC talking about we have some new dispensaries we have built in certain wards. But when we are coming to the budget, we are only saying, let's have this, we have not allocated for buildings of new dispensaries in several wards, and other wards are left. Or which that not, it means they are following another procurement plan which we have not budgeted for it, Mr. Speaker. So we need some clarification for that. Say that in the near future, what we have budgeted in this house should be followed, Mr. Speaker. Otherwise, I'm requesting, particularly that Tekat's sub-county, because it's my ward, Mr. Speaker, lest these people make changes in that hospital, especially its restructuring for its service to be improved. Thank you.
Thank you, Honorable Speaker. Maybe my question would go to the CC on the health committee that were put in place last year, whether they've done an induction for them, and what do they do on a continuous basis to make sure that they're working, so that we just do not have a ceremonial committee in place. Secondly, Honorable Speaker, I know every health facility in this country has a unique code called an MFL code. And you know, sometimes when we have low volume conversations in this assembly, sometimes we're not even able to understand what is this low volume conversation about the number of clients that are seen on a daily basis. Why do they still do a manual requisition for drugs, while they can still utilize the unique coding of the health facilities to order their drugs and also be able to track the number of clients that they see on a daily basis? So how are they leveraging on technology to make sure that they are able to give us the numbers that attend each facility on a daily basis? Thank you, Honorable Speaker.
Much, Honorable Eric. Any other member with the contribution to make? Honorable Emily.
Thank you very much, Honorable Speaker. My question goes to our Honorable CEC for health. Why are we not getting drugs in these dispensaries? I come from Sotik, and normally when I have some workers who normally go to Sotik Health Center and they come back without medicine. Every time they visit the facility, they don't get medicine. Likewise to Ndanai. So I want to know the reason why we don't have drugs in our hospitals. Thank you.
Thank you very much. Anyone, Honorable Nathan.
Thank you, Honorable Speaker. So I wanted to maybe give also a supplementary question, a small one. There was a health management committee that was elected last year. So I wanted to ask the CEC if the department has inducted the committee. And I also wanted to know how does he get the observation from this committee? Honorable Speaker, whenever we go, we visit the health centers, or whenever we engage with the members of the public, they are the ones who normally get the blame, or maybe on why health department is not working as well. So I wanted maybe more clarification, because it is also eating us up, because most of the time there are no drugs. At times we are told that they have been delivered. When you visit a facility, they tell you that they have only received the Panadol. So maybe I want to seek clarification on the same again, Honorable Speaker. Thank you.
Thank you very much, Honorable Nathan. Honorable Busine.
Thank you very much, Mr. Speaker. I want to thank CC for having answered some questions, but still we need some more clarification on issues which seems it do not have answers, especially on ambulance. Mr. Speaker, the CC said that there was an incident that our ambulance took one patient from Cheptalal to Litein. I come from a bordering ward. I border Kericho County. Most of my electorate go to Kapkatet Hospital, which is in Kericho. I've asked several times about this ambulance, and I was told that our ambulance do not go beyond the county. And at times, because I also come close to, I come from Kaplong, where there is a Kaplong Mission Hospital. There was a time, there was a patient we wanted to transfer from Kaplong to Longisa, and I was told again it is not possible because the new regulation is that you cannot take a patient from a private hospital to our facility. And we should be updated on these new regulations because our patients, the hospital might be private, but the patients are members of the public from our county. And the statement that the CC said seems to contradict what I was told by those who are in charge. Another thing, Mr. Speaker, there is this issue of there is a health center in Sotik, which Honorable Emily said. Recently, there was transfer of 3 clinical officers, and there is no replacement. I visited, and I don't know, maybe this transfer should be, when you are transferring, you should replace the same transfer, because I don't know why should PCOs be taken and there is no replacement, because for hospital which operates 24 hours, one doctor cannot operate for 24 hours for a week. Lastly, Mr. Speaker, my ward, Chemagel ward, there is no single construction of any health facility since 2017. We have a budget. Every year there is a budget. I don't know whether we have been being forgotten because I come from very far. I say I come from bordering, from the border. Sometimes maybe our departments, maybe they think that I come from Bureti, which is in Kericho County. I come from BOMET, and we deserve. We have a health center and 4 other dispensaries, and we deserve a construction just like any other ward. So, Mr. Speaker, those are the 3 main issues from my ward. I beg to stop there.
Point of information, Mr. Speaker.
Yes.
Thank you very much, Mr. Speaker. Just want to inform you and the House that you humbly request the Secretary and not to allow any other member to move out of these chambers until we accomplish the mission before us. I still have procedural motion, which I need this House to approve, Mr. Speaker. So if the quorum is not there, I will fail terribly, Mr. Speaker. So protect me, Mr. Speaker.
Okay. Sergeant at Arms, now that the majority whip has indicated that we might be having issues with the quorum, kindly have with you the bar. No member is allowed to leave until we have the business at hand, or unless the quorum in the House is ascertained. Honorable Felody.
Thank you, Mr. Speaker. First of all, I'm glad to be back from the maternity leave, and I want to give my condolences to the family of Damaris who lost life while giving birth at Cheptalal Sub-County Hospital. It is so sad. As a mother myself, I understand the pain that the family is going through. Mr. Speaker, through you, I want to seek clarification from the CCM whether there is a working framework that guides the operation of the ambulances and even allocation of fuel to for the use of these ambulances. Because I understand, Mr. Speaker, ambulances are meant for emergency services, and at no point should an ambulance lack fuel or not be in a good condition to do its work of providing emergency services. On April, I felt a victim of the same, where I had a patient at Cheptalal Sub-County Hospital who was supposed to be referred to Longisa Hospital. The patient could not eat, could not speak. He was in a wheelchair. I stayed with the patient from morning until 5, waiting for the ambulance to arrive for the patient to be referred to Longisa. I called the authorities concerned, and I was taken in cycles from morning until evening, until I was worried what to do, and I have a patient. The patient was not a family member or anybody from my family, but the patient was a resident of Mbomos ward. I thank God that the patient managed to reach Longisa, but I used other means. And the ambulance was parked just outside the hospital. I kept wondering if that is what happens in all our hospitals, what will happen to our people? What will happen to the common mwananchi? If the same can happen to me, and I am at least I have a title. I struggled. I almost called you, Mr. Speaker, but unfortunately, I knew you could not help because it's not your area of jurisdiction. What I am just asking the Department of Health is to put frameworks in place that guides the operation of the ambulance and the referral system so that we can help our people. Secondly, Mr. Speaker, is to let the CEC know that this case is happening just some few weeks after the Longisa incident. What will happen if measures are not put in place to correct this? Because another incident could happen. And I don't think offering a job to the father is a solution, or even helping the child is a solution. Well, it's helping. I want to appreciate the department for that. But what is the long-term solution? What is the department doing to ensure that this does not reoccur? We cannot be budgeting money for fuel and we don't see the services being offered to our people. Mr. Speaker, it is sad to lose life while giving birth to life. Thank you.
Thank you very much. We understand now you are a mother and you are talking to congratulations on that.
Thank you.
I would have wished to ask where you went yourself. Was it our facility around?
Mr. Speaker, I feared for my life, so I went to Kericho. Thank you.
Honorable DS.
Okay, thank you, Honorable Speaker. First of all, I want to thank the CC for an elaborate report which he has delivered in this House. In the report, he has elaborated extensively how the department intends to improve the casualty. But I still have some concerns surrounding the casualty. In fact, the casualty is where everyone got the information on the patients which were brought into the hospital. I have extensively and several times watched the video which was circulated in the social media. And I noticed two things. The first one is the person who was talking to the nurse in her station. It shows that the person was talking like just an intruder who didn't have anything to do within the casualty, as per the voice and the way they were talking with the nurse. Again, when the two were talking in the nurse station, there was a child. One of them has been mentioned. One was among.
Honorable Emily. Now, I hope you've seen what is there. It bears any member from leaving. If you go and you don't come back, you'll be out of order. Unless you are going this way. You will ensure that she goes this way only, but not out of the chapel. Okay. Let's proceed.
When the two were conversing, there was a patient behind who was struggling in the bed, and I was worried on the way the casualty was being furnished, because the nurse station is facing away from the patients who are lying in the bed. So I think there is an issue with the way the casualty has been furnished. Number two is maybe to ask CC if there are mechanisms which prevent people from videography. Because the person who was taking videos inside the casualty, I don't think it is within the required tenets on how an hospital setting is run. Because very soon we'll get another video taken inside of a maternity or even theater. I'm not denying the fact that the person who took video actually uncovered maybe some of the caps in the hospital, but I don't think it is the right thing to allow physiotherapy inside an hospital setting. So are there mechanisms, are there posters which is showing the patients what it's supposed to do, so that we will not be having people just entering into a casualty and talking recklessly, laughing, you see, when the patients are struggling in bed. And then also someone, an intruder or a patient caretaker, just taking videos in the hospital anyhow. Kindly tell us if there are mechanisms which can prevent such issues, because we want our referral hospital to be a center of excellence, because it's a referral hospital where all of us in the county are referred to. So kindly elaborate on such measures, because it is actually the nerve center of what thrilled the whole county. I think everything surrounding that video is what they listed, what we are undergoing, even up to now. My neighbor seated here is also asking me to ask why FIF is not implemented as reported. I think you had answered that, but it's still asking why FIF is not been implemented as reported or as done by the health committee. Thank you.
Thank you very much. Lastly, Honorable Anne.
Concerning the Department of Health, there are so many challenges has been raised in that department. And to our CC, I just want to from the central point, a ward which is in the central point of BOMET County, I have about 3 concerns. I've got a dispensary in Kapsimoto town. It has an incomplete maternity ward. In Silhouette dispensary, I have a maternity which is already, it is well equipped, but it is not operational. For BOMET Health Center, there is a maternity wing, but not fully operational. Concerning the crisis which is being faced in the Department of Health, I think we are not looking now for the problems. We are looking for the solutions. So to the CEC, we want to know the plans which you are put in place so that we reduce all these challenges. Because if somebody loses life and is in the hospital, it raises a lot of questions. Why? What happened? And where were they? So to our CEC, let's give us your plan, or what you are planning to solve all these problems being faced in the Department of Health. Thank you, Mr. Speaker.
Honorable Langat.
Thank you very much, Mr. Speaker. What I just want to clarify, I want to ask is about the authority, if the department is to stamp the authority, because there is an issue in Irwaga Health Center whereby the lab technician has not been in the facility for about 4 months. Now, when the governor was launching a book in Tumayot for a certain book writer called Sang, he was asked the same, and he called the CEO, Felkip, to answer that question. He came and he answered that he was to report on Monday
That day was 19th of October. That Monday was supposed to be 22nd. And there was no, that lab technician up to yesterday when he reported. I don't know now if the department should be giving the authority, or that lab technician was to move by his own time. Maybe that is the question I'm asking before our CEC, because for lab technician in a health center, we had some mothers giving birth without the test of any lab test. So that is the question. Thank you.
Thank you very much, Honorable Langat. I believe all the questions you have captured as a department. Of late, we've seen that in most of our departments there is laxity. I don't know why health this time. We've never had such before. But surely it is becoming an embarrassment to all of us. I want to urge your department, CEC, everybody to wake up to the call to serve the people. If anybody is not in a position to do so, please allow others to come and serve. Staff who are in the different facilities within the county should rise up to the occasion and do what they are supposed to do to ensure the people of BOMET get services. If any of the employees feels that he or she cannot work, they are free to resign and do their private work elsewhere if they don't want. Otherwise, this embarrassment is becoming too much. Just on behalf of all these members, we want to thank you. I hope you've heard all the questions, but I will ask the clerk here to condense all the questions and give it to the CC so he can answer in writing all the other subsidiary questions which are there. Unless you have one or two you want to answer right now, the ones you have the answers, I'll grant you 5 minutes. And members, no questions after this, please. Let us agree.
Thank you. Thank you, Honorable Speaker. On induction of health facility management and boards, we actually have talked to the in-charges, MOHs, and the in-charges of facilities, and we have even inducted them on FIF, and we intended that they escalate. But we take guidance that probably we need to see them individually. We are leveraging on this technology in decision making, especially in ordering drugs. The MFL codes are generated when you have visited the site, and it is done by GIS. And then when you're ordering drugs, we use technology, but we collate at the county and send it to, we actually see what is available at KEMSA through the county pharmacist. Honorable Emily asked about the drugs in dispensaries, Sotic and Dana specifically. The main challenge with drugs is as you order, you don't know how many people will come to a certain ailment, and there are certain fast-moving drugs, and some of those drugs are the ones that people say hakuna dawa in quotes. But you will find that there are drugs for other conditions like high blood pressure, diabetes. We rarely run out of them. There are certain drugs that are there. The other thing is that the issue of drugs depends on the prescriber preference. One of the key things that we've done, and we want to emphasize, is to ensure that what you prescribe is what is available. When it is not available, give an explanation. And we think that will be will help us. But in general, the assumption that drugs are not available is normally because of certain key drugs that sometime run out, and especially the ones for children. Sometimes KEMSA does not supply. Honorable Nathan Kibet also asked, MCA for Kabletunda also asked on the same thing on HMF induction, and the only way we get reports from this is through meetings. In every meeting that they have, we have a staff from the sub-county who sits there, and they give us reports together with the minutes that they have. Some of the issues they raise come directly to my office through the chief officer, and we act on them. On CHPs, I want to say we are working on their payment because there is a budget, and it's already in the IP, so we'll pay. The delays have been with the issue of special purpose account, and the fact that some of these members gave accounts or numbers that belong to their spouses. We are working on them. So we are actually looking at them. Commissioning of Sitotwet, it is in our agenda. The only challenge is that we have very serious shortage of staff, and the limit for HR in the whole county has been affected, and we are past, and I'm sure this House is aware that we are past. But with the FIF, we will be advising the committees that they should budget to ensure that we get staff. So we can give one staff as a county, the rest will be by the committees. We plan to complete the incomplete projects, including Kimuchul Laboratory, and in our location, we've included each of the wards to have that. There was something on Tegat sub-county, which Mheshimiwa Honorable Member from Kembu asked. Tegat, for a long time, was actually given a raw deal in terms of even the leadership. Currently, we've posted a full-time MOH there so that he becomes the lead, and we have capacity built the teams by ensuring that they sit in Tegat. Previously, they used to sit in Longisa, and that was giving it was not going okay. Mheshimiwa, I visited Tegat. When we had the big camp, we were with you, and we discussed the issues. Even when it came to renovating the renovation in Tegat, it was through discussion with you, and we saw it was a priority to have Tegat. So it is in our heart. The same thing with Longisa. Tegat and Longisa wards are the same. By virtue of the Longisa County referral being there, there is a lot of suffering that people of those wards suffer in silence. We've built Cheboin and Olmoswet to facilitate services where people don't pay. Because when you come to Longisa, you pay. We thought of making autonomous, Longisa County referral autonomous, but I think with the FIF now, there's an element of autonomy that comes because the board there will be deciding mostly what they do with the budget they get. The other question, Honorable Pusiene, I agree that there have been clash of information on the use of ambulance. We'll be reviewing, especially now that SHA will be contracting ambulance providers to provide those services as a service. So we'll remove this, and where there has been a challenge is because there are hospitals that have ambulances, but they are passing the burden to us in the name of the county is offering free. So that's where the conflict was. So in addressing that, we will look at that again, because as you rightly put it, patients don't even know the issue of private facility. All they want is a service. So we'll review that policy. We worked on Chebongi in 2017, and I agree with you that it is probably the last time we were in your ward. But we've tried to help Sotik. The only challenge has been the issue of finance, and finances coming in time. There was a proposal to have a dispensary next to Kablong, just on the way Mumberes area. It is still there, and in our plans, we'll need to do. We'll be looking at it, Honorable Speaker. The concerns raised by the Honorable Deputy Speaker on the Longisa County Hospital. The video was taken before even we knew that there would be a problem. If you look at the video very, very nicely, that child who is standing on the bed, there was a procedure going on. If you look at near the head side, there were 3 bottles. And the doctor who was there was trying to get a blood sample from that patient. And it was proving difficult. He left the patient under the care of the caretaker, who supposedly is the one who took the video. That video does not tell you what happened before that video was taken. And it doesn't tell you what happened after. Because it could have been taken and something happened immediately. And according to our estimation, and I've asked one of the senior doctors in this country to look at the patient and give me the estimate of the age of that patient. Most people agree that that child is not a 3-year-old child. I even went and looked at the body in the mortuary. The patient who died is a younger one. So this picture was of a patient who was being attended to. In fact, the more serious patient is likely to have been somewhere else under care of someone. The person who was speaking to the nurses, the clinic officers, actually agree with Mheshimiwa that he intruded. But he intruded in a very complimentary, he was complimenting them. And you see, once somebody greets you and comments about why you did not stop while he was greeting you yesterday, the comment she gave is that I was rushing to work. And then the comment he made is that, oh, kumbe nyi mnapenda kazi sana, and they laughed. That's the only time that comment was made. If you look keenly, on the right side, there was a patient being asked questions. And on the left side, there was a younger patient who was also being attended to by those people you saw who were in front of a screen, because they were putting the notes on the computer. So it is a picture which is capturing a moment, but doesn't tell you things beyond what is there. But I agree that there was intrusion.
What's your point of order?
Point of order, Mr. Speaker, through your chair, is the CC saying that he is disowning the video that was circulating, that it doesn't belong to the deceased. I think he needs, through your chair, you need to clarify that the video that we saw that went viral is not the video of the child. That's what he is saying, Mr. Speaker. Can you confirm from him so that the members of the public can get to know? Because we've had a series of what happened and it's not connecting. The dots are not connecting, Mr. Speaker. It was the other day names Diana, not Diana. Now that the CC is saying the viral video is different from the child who died.
Okay.
Thank you, Mr. Speaker.
Can I respond to the honorable member?
What I was saying is that the picture is capturing a moment. It doesn't tell you what was happening before and what happened after that. That is what I want to emphasize. As to the video being of the child, it is just my own observation that it looked like an older child. There were children who got well and went home. There's a possibility that is one of the children who was seen and went home. But I will not stick to that. What I'm trying to say is that it captures a moment. And it doesn't even tell you the good work that the other doctors were there. In fact, they are being vilified for discussing while a patient was reading. But there was another officer. There was another officer.
Mr. Speaker.
Yes.
The CEC is not answering the question. He is going around the question. Because he is in a position, he got the access of a CCTV, and he's telling us he's not sure whether it was that child. Let him confirm before this house whether the video that we saw is there for that child or not. So that we are not left in a confusion, Mr. Speaker. That's what I only require from the CC.
Point of order, Honourable Speaker.
What's your point of order?
Honourable Speaker, the same others have not been completed in investigation. The reason why I'm saying so is that even the burial permit has not been issued. The reason why it has not been issued is that the body which was received in the mortuary is Ruth Chemngeno. The child which was said it was another information said Diana. So
point of order,
investigation.
Point of order, Mr. Speaker.
Give me time. The investigation is still on, and I think the final report will be
point of order,
to this
Mr.
House,
Speaker,
so that we can know exactly who is who and who is saying the truth.
Point of order, Mr. Speaker. Is in order, is the chair held in order to lie to this House that the burial permit has not been given and the child has been buried? What is this confusion? Now that the chair held is standing and giving wrong information, the CC is here giving wrong information. Where do we stand, Mr. Speaker? And I don't know whether you need to call out the chair for telling us that the burial permit has not been given, and yet we know. Personally, I attended that funeral, and he was there. Only that we didn't even get an opportunity to say our message of condolence because of how charged the crowd was. Now that he brings another confusion that the burial permit has not been given and the child has been buried. Who is lying to whom, Mr. Speaker? Is he telling us that the child is still lying in the mortuary? Then Waziri should confirm to us whether that child, Diana, is still in the mortuary. And again, Mr. Speaker, look at the chair in the eyes, telling this House that it is Ruth, and CEC has confirmed that it is Diana. Mr. Speaker, there is a problem. We don't need to joke with people's lives, Mr. Speaker. This House is not for jokes. This is a serious House, Mr. Speaker. We cannot take ourselves in cycle, and we are discussing a very serious issue. Mr. Speaker, call out the chairperson for that.
Chair Health, you know what you're giving is really, really serious. How can a whole ceremony, the burial ceremony has taken place and there was no permit?
Honorable Speaker, the hospital still hold that burial permit. Reason being, the names are diva. They diva the name. The family come with the affidavit, but the affidavit was wrong, and there were no any burial permit being issued. I'm not lying in this House. Even when we go to the family, they don't have the burial permit.
So why did you bury without the permit? This is serious. I don't know whether the chair is... might you be contradicting yourself, Chair? Maybe something needs...
See, but yes, Honorable Speaker, so I'm not disowning the video because I don't have complete proof. Let me say, I withdraw that part. But what I'm saying is the video captures a moment in time. It doesn't tell you what was happening before or after. But something was being done for the patient. Unfortunately,
when you withdraw, you have to apologize to them.
Yeah, apologies, Honorable Speaker. On the issue of and I was going to come to that part because when the patient was referred to Tenwek, the name Diana was there. But when the relatives brought the body, they registered as Ruth. So one of the first things that the hospital tried to do was to ask for the birth certificate of that child so that they can maybe verify and take that. But that birth certificate did not come. On the day of the burial, because of this confusion, somebody swore an affidavit to say this is so and so. But the person who swore the affidavit is not the one who brought the body. And the issue of now the notification also depends on a postmortem, which has not happened. And since this was a matter that was of public concern, denying these people to bury would have really been a very emotive issue. An understanding was done that they will try and come and rectify this. It's not a big issue because it can be given on condition that the one who brought the body agrees, maybe by affidavit. The lawyers can advise us, and then we'll give. In the end, what we want to do is to ensure that we actually are talking about the same person, and it is very likely that we are talking about the same person. Only that the relatives, we require them to come and give us that why they don't have a birth certificate and why they had these two names. It's not that we have any ill motive. Thank you. So on I think that was one of the few things that I had an answer to immediately. The rest, Honorable Speaker, I am ready to answer in writing for any of the other, including even these ones that I've responded to.
You have a week, Honorable CC. Otherwise, on behalf of this House, I want to thank you and your team for making time to appear before the honorable members. And thank you for answering all the questions that have been asked. Those ones which you will go and look into, kindly have them in writing and send them through the chair for these all House to consider. As of now, you are free to leave at your own pleasure. Otherwise, you are still welcome to observe what is going on. A question or two might still come your way. But please uphold the service to the citizens. Take it very seriously. Thank you very much. Clerk. Sanitation is around.
Mr. Speaker.
Yes.
I humbly request you to allow me to move the procedural motion before the CC arrive.
Which procedural motion for? The order paper is not yet done.
Yeah, altering the calendar.
We still have order number 8. Which procedural motion?
Honorable Speaker, point of order.
Yes, what is your point of order?
The procedural motion for altering the calendar cannot come first because when we passed, we stop immediately. So we request the honorable member to wait until we complete the business of the day.
I had directed that no members leave the House if the quorum is not ascertained. Honorable DS, you are out of order if you go. Kindly come back. We confirm first whether we have the quorum. Do we have the quorum? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, you can leave, but you will be out of order if you don't come back. Yes, let's proceed. From here, I'm reliably told that the CECM for water, energy, and sanitation is not within the presence of the. You are showing, what are you saying? And come back. All right, so CCM for water, energy, and sanitation. I don't know whether she wrote back to say that she will not be available. Clerk, do we have communication? So, honorable members, Honorable Juliana Chepkuto, who is the acting CCM water and energy sanitation, has not met the House, and probably we'll discuss further on what we will do with her.
Point of order, Mr. Speaker.
What's your point of order on
I am the one who raised that the statement.
Yes.
And the CEC has not appeared. And I am very sure she received the invitation. And up to now, there is no response from her office. So it is my humble request, Mr. Speaker, with your directives, that the CEC be summoned to appear before this House. Thank you.
For the second time, we summon her again.
We summon her again. I think the letter that she received was just an invitation. But right now, we have to send her summons.
Okay. Noted.
Order, Mr. Speaker.
What's your point of order, Honorable Member?
I was with Chepkuto yesterday,
Yes.
And she was very busy preparing to go to Busia. I think she went to Busia this morning.
Point of order, Mr. Speaker.
Was she aware, now that she was with her, was she aware that there was a question before her? And she was required to be...
Let the honorable member confirm if she is personal assistant to the CEC, Mr. Speaker.
Point of order, Mr. Speaker.
Kindly confirm if you are an emissary of...
Point of order, Mr. Speaker. I was just reporting what she told me yesterday. So when I heard about her name, I just let me rescue her. Because she was...
But you are not substantiating. She needs to
confirm the M-Pesa.
To confirm that she will be there or not through writing. If she doesn't come to the chamber, then she has to explain why.
Point of order, Mr. Speaker.
Yes.
Point of Mr. Speaker.
Yes.
The honorable member has just given information that she made the honorable member, the CC. But I won't dwell on that, since that only serves to tell us how they disregard this house as a cabinet, Mr. Speaker. And for us to bring back sanity and respect in this house, Mr. Speaker, I would wish that as the Speaker of the statement has requested you, that let's turn this as a summon, let's put this as a summon. And again, Mr. Speaker, I would wish that as this honorable, as the CEC appears before this house, I would wish, this is a new thing. We amended our standing orders. I wish that you take us to for a training on how to behave when a CC is here, so that the chair does not behave as a CC when the CC is seated here, Mr. Speaker. And you see, the role of a chair really is to assist us to seek more information and clarification from the CC, and not to defend the CC, Mr. Speaker. So you'll help us, take us for a training. I understand that's the situation that we are today.
Point of order, Honorable Speaker.
Let him finish.
Yes, so that I finish, Mr. Speaker. Train us so that we should transition from where, as a chair, you are giving a position or a statement from a CEC to now a position where the CEC is here. I would wish that I am requesting so, Mr. Speaker.
Okay, Chair Health.
Honorable Speaker, I don't know if he was moving a motion because he is taking a lot of time discussing a conduct of a different person without a substantive motion as by the standing orders.
Sergeant at Arms, kindly come forward. I believe we are done with that issue. Clerk, let's proceed.
Order number 8, the BOMET County Finance Bill 2024, third reading.
Honorable Speaker, I'd like to move that the BOMET County Finance Bill 2024 be read at that time. Honorable Speaker, maybe before it is read, maybe I would like to inform the House that as a committee on finance and economic planning, we have done almost all the processes. We did a public participation in all the 5 sub-counties. Honorable Speaker, we also invited the Chamber of Commerce to our meeting, where they also shared their views on the finance bill. We also met some of the business people who also gave their views on the same finance bill, Honorable Speaker. After the public participation, we did the second reading, and during the second reading, we also went through the committee of the whole House. So, Honorable Speaker, I want to urge this Honorable House that we move with speed, because finance bill is a very critical tool in revenue collection. We have always been complaining that we have not been able to raise the revenue. But I think when we pass this finance bill, it will also be it will also assist in maybe achieving the revenue target that we currently have. Honorable Speaker, I want to request Honorable Josiah Samoy, a member of the committee, to second. Thank you.
Thank you, Mr. Speaker. I second.
Thank you very much. You are seconding what? The third reading or what?
Third reading, Mr. Speaker.
Okay. Clerk. Now, I therefore propose that BOMET County Finance Bill 2024 be read that time. The floor is open for debate, honorable members. Going by the mood of the House, I proceed to put a question that BOMET County Finance Bill 2024 be read that time. Will as many as are of this opinion say aye? Aye. Will as many are of the contrary opinion say nay? The ayes have it. Clerk, kindly read the bill.
The BOMET County Finance Bill 2024, a bill for an act of the County Assembly of BOMET to provide for various taxation, imposition of fees and charges for services and other revenue-raising measures by the county government, and for matters incidental thereto.
Thank you very much. Honorable members, when a bill is passed, you are supposed to applaud, because you've done some good work. Just before we conclude, Honorable Peter Ono had asked this House that I give direction on the committees. Standing order number 197, 198, and 199 indeed provides the Committee of Appointments, PAC, PIC, and Budget Appropriations, respectively, that were constituted immediately after the general election were to serve for 3 calendar years, and those that are constituted thereafter shall serve for the remainder of the term of the Assembly. I am aware that the current stated committees have served for approximately 2 years, 2 months, given that they were constituted in October 2022. The selection committee is, however, notified of the impending reconstitution of the said committees once the term of the current ones expires. So thank you very much. The House is accordingly guided. Any other issue?
Okay, thank you very much,
yes.
Mr. Speaker, for giving me this opportunity. And you can also allow me, Mr. Speaker, as a father, also to a bona fide family and also an elder. Allow me also to congratulate Mheshimiwa Feloti for being one of the parents.
Are you saying the father?
No, I'm not saying the father to the children. I'm saying being a father to my children, Mr. Speaker, and also being an elder. I should also take this opportunity to congratulate Honorable Pelot. I know before she left us, Mr. Speaker, we had a very serious work of impeachment, and she fully participated, Mr. Speaker. And and Mr. Speaker, because she has come back, we want to laud her and also to give her a blessing of this house, so that when the kid is coming up, we also bless him that in future he will be one of us in future. When we shall be old, he will take over from us. So congratulations, Velot. And Mr. Speaker, allow me to move a procedural motion. Honourable Speaker, I beg to move the following procedural motion: that notwithstanding the resolution made on 28th February 2024 at 2:30 p.m. approving the County Assembly calendar regular session 2024 and pursuant to the Standing Order 28, this County Assembly resolved to alter its calendar so as to adjourn for the long recess today, Thursday 28 November 2024, until Thursday 11th February 2025 at 2:30 p.m. and that the calendar of the third session, regular session 2024, be amended accordingly. Mr. Speaker, I know we are approaching festive season, Mr. Speaker. Our young boys were initiated, and I know some of us, Mr. Speaker, for instance, Honorable Karen, Honorable Irkirui is also a father to initiated boys, which are in their silent place, which our mothers doesn't know what is happening there. We should join them in this very, very important festive season, so that we can also celebrate their young kids coming out of the college, Mr. Speaker. And in due respect, Mr. Speaker, allow me to welcome the majority leader to second, and also to allow these members to debate on the same. Thank you very much, Mr.
Thank you, Mr. Speaker. I rise to second the motion by the majority whip that we proceed on recess. There are a lot of business that is still pending, and I think because we are supposed to proceed next week, committee members would like to conclude the business that is pending so that they'll be able to hand over the reports as they are on the recess that the majority leader has moved the procedural motion. I therefore second, because this will actually give the members ample time to attend to issues in their wards and also to participate in the festive programs that are coming ahead of us. In fact, some committees are right away leaving, especially the finance, on a retreat, and there are also some members who will be leaving next week, taking about 5 days. So I think this is the right time that we support this motion so that members can proceed on the same. I therefore support, Honourable Speaker. Second, Honourable Speaker, thank you.
Thank you very much. May I have that document? Honourable members, this is a procedural motion. I want to thank the majority whip and the majority leader both for what they've done, and therefore propose that notwithstanding the resolution made on 28 February 2024 at 2:30 p.m. approving the County Assembly calendar regular sessions of 2024 and pursuant to Standing Order 28 for this County Assembly resolves to alter its calendar so as to adjourn for the long recess today, Thursday, 28 November 2024, until Tuesday, 11th February 2025 at 2:30 p.m., and that the calendar of the third session regular sessions of 2024 be amended accordingly. Honourable members, the floor is open for debate. Honourable Nathan.
Honourable Speaker, I rise to oppose the motion. Honourable Speaker, I like the fact that Honorable Majority Leader, while seconding, mentioned that the Finance Committee are currently dealing with the ADP. Honorable Speaker, we are supposed to pass the ADP before we go for recess. Honorable Speaker, as you are aware, ADP will guide the CFSP, and CFSP is supposed to come to this house by end of January. So if we go on recess now, it will be hard for us maybe to pass this ADP, and it will also be hard for the department to start preparing the CFSP. Honorable Speaker, I oppose. Thank you.
Thank you very much, Honorable Ernest.
Thank you very much, Mr. Speaker. I also rise to oppose because this motion is untimely, and I don't know what informed the majority whip and the majority leader to ask members to go for recess while we have a communication from the governor on the CCs, where the appointment committee should sit and bring a report about the appointment. Mr. Speaker, in that communication that you made, it is very important, especially for the CEC in charge of roads, Honorable Ambrose, who is coming from my ward. And we have a problem in roads, Mr. Speaker. I would wish that we fast track. There's this out, the appointment committee vets, and then we have CCs, new CCs in those departments before we go for Christmas. Secondly, Mr. Speaker, there are serious issues, like the one for Cheptalal Sub-County Hospital, that you had given 7 days to be acted upon. And Mr. Speaker, by us going for a long recess, it therefore means the issues that you had raised will not be dwelled with. Again, Mr. Speaker, going for a long recess, Mr. Speaker, means we are ending the year. And I don't know how we are going to attend to our committees, Mr. Speaker. These honorable members still have a lot of work in their committees. So if we go for a long recess, it therefore means we've ended the year and members will not be able to attend to committees. Mr. Speaker, I oppose the motion. Thank you.
Thank you very much. Just for your information, Honorable Ernest, this was due for next week as per the calendar. Yes.
All right, Honorable Mr. Speaker, thank you. For the first time, Mr. Speaker, we may not go on the same line with my majority, whip and majority leader, Mr. Speaker. I think we have some unbending business, Mr. Speaker. To be real, as this honorable house, we still have some pending issues which we would not like to leave it before we go for recess. So I'm begging and I'm requesting my seniors, whom I respect very much, especially my elder brother, Honorable Majority Whip, Mr. Speaker, kindly reconsider if you can redo your request to be in 2 weeks' time. That would be much better, Mr. Speaker, especially because I'm a finance student, Mr. Speaker. I understand what Nato was saying, and especially my good friend CPA Eric, Mr. Speaker, could understand more well that in end of January we will need to come up with the ADB will guide the CFSP, of which we will not finish the one which led by Nathan will not go well, Mr. Speaker. So kindly let's reconsider it, finishing the business, and then we will go for a recess. It may take us time, but it will help us to guide the coming calendar, Mr. Speaker. So I do oppose.
Thank you very much, Mr. Speaker.
You are the mover of the motion.
Yeah.
So you allow other members to contribute. You'll have the right of reply at the end.
Yeah.
Honorable Changmori.
Thank you very much, Honorable Speaker. I stand to support the motion. Honorable Speaker, it is true that we have a lot that we have to do, as has been said. But if there is any need of passing any ready, we can make a gazettement so that we can have a special sitting for the same. So that is why I support that we continue with the recess.
Honorable Emily.
Thank you very much, Honorable Speaker. I support the motion, but I have something else to ask you. I wanted to ask you, why are you directing the vetting to appointment committee of the CECs? I thought the CECs are being vetted by the different committee, the CECs. I just wanted to know. Otherwise, I support the motion.
I think as per the standing orders, the CECs are vetted by the appointments committee, whereas the chief officers are vetted by the different committees. Yes. Any other person who wants to contribute on the motion? I believe next week, because we may not meet. I know some of you are committed, and some of you may be required elsewhere. And it is very important to note, around 15 of you will be required elsewhere, and the whole of next week, I know we may not be around with us. Maybe that is what has informed the leadership to take that action. Any other person who wants to contribute? Now, the person who wanted to... Now is your time, right of reply. Honorable Bushina, you want to say something?
Yes.
Okay, proceed.
Thank you very much, Mr. Speaker. I rise to support the adjournment, since we want to follow our calendar. Mr. Speaker, I know and I feel what our chair finance feels because of a lot of commitment. But other departments, Mr. Speaker, we have to learn to finish our businesses before we conclude the calendar of the year. Of note, Mr. Speaker, is Honorable Bernard from Kembu, who requested for special sitting, and he was not around. So meaning,
point of order, Mr. Speaker. Point of order, Mr. Speaker.
What's your point of order, Honorable Bernard?
May I request Honorable Bushine to substantiate whether I was not there during the special sitting. Mr. Speaker, the statement which was being answered today by the Honorable CC, Mr. Sitoni, Mr. Speaker, was my question which I raised on that day of special sitting, Mr. Speaker. I understand, Mr. Bushine, wherever we are in this house, Mr. Speaker.
It's not Mr.
Honorable Bushine, wherever we are in this...
Use the right notation.
All right, I'm sorry, Mr. Speaker. Wherever we are in this honorable house, Mr. Speaker, Honorable Bushine sometimes is taking a lot of notes. I don't know, notes. He's not forecasting who is in, who is out, Mr. Speaker. So that is the main problem. But I want to clarify to him, Mr. Speaker, during that special sitting which I requested, Mr. Speaker, a number of issues has been raised in this county, Mr. Speaker, of which I thank myself for having requested for that special sitting. Otherwise, we could not have known that Mr. Honorable Majority was almost being austere if it was not for the day, Mr. Speaker. So I'm requesting to you, Mr. Speaker, let Honorable Bushene, that is Honorable Dennis Bushene, to withdraw and apologize for the people of Kembu before proceeding in his own statement, Mr. Speaker.
Mr. Speaker, thank you very much, Mr. Speaker. I didn't even know, Mr. Speaker, that the issue that was supposed to come was the issue of health, because according to Cassetman, it was not clear. And when you call a meeting without agenda, you become the agenda. So a majority leader just became a victim because there was no business. So we saw that honorable from...
but he has confirmed that he was there on that particular day.
I didn't see him, Mr. Speaker. Maybe he changed...
I saw him and I saw him make the statement.
Okay.
So you will withdraw that statement.
So I
apologize to you.
I withdraw that one, Mr. Speaker.
Then proceed with your statement.
So my statement is that, Mr. Speaker, I support that we adjourn, and if need...
He has not apologized. He withdrew, Mr. Speaker.
Withdraw and apologize, please.
I withdraw and apologize, Mr. Speaker. I was saying, if need be, Mr. Speaker, when the finance chairman is ready to present this, have they concluded, we are ready for a special sitting. So, Mr. Speaker, I request honorable members to support that we move for a recess, because we have pending issues in our wards. We have taken a lot of time here. We need a break. Thank you, Mr. Speaker.
Honorable Deputy Speaker.
Okay, thank you, Honorable Speaker. I support that we proceed today for a long recess, but I want to make a request, Mr. Speaker, sir. When you deliberated on the statements which are due, there are 3 committees which you told them to fast track on their questions. That is the Committee on Health. You gave them 7 days. Committee on Administration. You also allowed them 14 days to finish on the statement which was asked earlier. And also Finance Committee. You also gave them 14 days to dispense on the same. In that case, Honorable Speaker, I request that we adjourn today for long recess, and you allow committees to have their sitting for 2 weeks, that is 14 days. Okay. So that they will also have time to sit in their committees and clear out the businesses which are still pending within their committees. Otherwise, I support, and that would be very fair. When the ADB report would be ready and the report of appointments committee is ready, we can have a special sitting so that the 2 can be passed.
Okay.
Thank you.
Thank you very much. And I think I agree with what you have. Whether you approve it now or you approve it next week, we can still have up to the period just near Christmas. The committees can still continue with their sittings to allow the members to dispense the business which is with us. Anyone who still wants to contribute to that?
Honorable Speaker, maybe I want to seek clarification from you. Unless you confirm to us that you will call a special sitting, I still oppose, as I said earlier, Honorable Speaker. I said this, the issue of ADP is a serious issue because it will guide the CFSP. So maybe you will guide us if you confirm to us that.
I have no problem. As of course, for one to have to be granted the special sitting, at least 12 members have to agree. And I don't think you will miss that, considering that these are very, very important.
Why will I get the 12 members, Honorable Speaker, when they are in recess? I know, and this is a very stiff season.
It's upon you to discuss on that. Honorable Majority Whip.
Okay, thank you very much, Mr. Speaker. Personally, I just want to laud the honorable members who have supported the motion, and I just want to inform our senior chair, finance, that what is going to deal with is something which is very important to this county, Mr. Speaker. And I want to give assurance that we shall support him in ensuring that we adopt a report as early as they completed their report writing, because I know they will be going for retreat to work on it. And I believe the number of days is going, Mr. Speaker, will not even allow them to participate in the plenary. Yesterday, Mr. Speaker, I had to request you to adjourn the House, Mr. Speaker, because of the quorum. And I know some of the members may be going also for some other serious activities outside our county, Mr. Speaker. Around more than 15 members will be out of this county, Mr. Speaker, next week, which I also predict that the quorum will not allow even the member to adopt a report, and we don't want to frustrate the committee on finance on a serious matter before us, Mr. Speaker. So it is my humble request that all the members to approve this report, because this motion, because it is of importance to all of us. And without doubt, Mr. Speaker, I know most of these members who are claiming to be seriously coming on that day, Mr. Speaker, I'm not criticizing anybody, Mr. Speaker, but I know most of them, Mr. Speaker, are very serious absentees, Mr. Speaker. So it is very bad for us to have a plenary going on when we know that we shall not attain the quorum, Mr. Speaker. So in my humble submission, I request this House to adopt this motion, Mr. Speaker. Thank you very much.
Thank you very much. Honorable Chair Nathan, on that day, if you need anything, the work of the majority whip or minority whip is to whip the members. It's not you. For you, it's just to be ready, and the work is well cut for the majority whip. I therefore proceed to put the question that, notwithstanding the resolution made on 28 February 2024 at 2:30 p.m. approving the County Assembly calendar regulations of 2024 and pursuant to Standing Order 28-4, this County Assembly resolves to alter its calendar so as to adjourn for the long recess today, Thursday, 28 November 2024, until Tuesday, 11 February 2025 at 2:30 p.m., and that the calendar of the third session, that is regular session 2024, be amended accordingly. Will as many as are of this opinion say aye?
Aye.
Will as many as are of the contrary opinion say nay?
Nay.
I'll ask again. I want to hear. Will as many as are of this opinion say aye?
Aye.
Will as many as are of the contrary opinion say nay?
Nay.
I'll call for division now, because I really can't tell who is who. Clerk, kindly proceed with the... Do not leave the chamber. I need to...
Mr. Speaker,
yes.
Nobody stood to defend the nays.
Let's have division.
Honorable members, no one is allowed to leave. Division bell. Kindly ring the division bell. No member is allowed to leave the chamber.
Magbendi. There I imagine there.
Let's proceed. Kindly have a seat. Take your chairs. Come forward. Honorable Ernest, who takes the ayes? Honorable Whip, Honorable Ernest, you will take the nays. So the clerk will call. I hope there is no. I don't know whether someone will abstain. I don't know. This time I'll not allow abstaining. Clerk, read out the names. You answer by yes or no.
I have it in there. I'm not ready to
Let's proceed.
Honorable Korir Philip Kiblangat.
Absent.
Honorable Kipatich Wesley.
Absent.
Honorable Langat Charles.
Absent.
Honorable Robert Langat.
Absent.
Honorable Dennis Buziane.
I vote yes.
Honorable Paul Kirui.
I vote yes.
Honorable Peter Rono.
Absent.
Honorable Nathan Kibet.
I vote no.
Honorable Roslyn Chepto. Honorable Ngeno Dennis.
Absent.
Honorable Samuel Josiah.
I vote yes.
Honorable Peter Mutai. Honorable Bernard Rotich.
Absent.
Honorable Ngatich Kibet.
Absent.
Honorable Langat Peter.
No.
Honorable Langat Bernard.
No.
Honorable Koech Stephen Jamorik.
Yes.
Honorable Richard Ruto.
I vote yes.
Honorable Chepkemo Ann. Honorable Kirui Dansel.
Absent.
Honorable Kipkirui Josephat.
Absent.
Honorable Rotich Leonard. I vote yes. Honorable Kirui Eric.
Just say it, we can hear you.
I abstain.
Honorable Rotich Ernest.
I vote no.
Honorable Jeruyot Chafet. Honorable Evelyn Mibay. Honorable Caroline Chalangat.
I vote yes.
Honorable Monica Manye.
Absent.
Honorable Emily Jeruyot.
I vote yes.
Honorable Evelyn Sang.
Absent.
Honorable Cherono Karen. Honorable Chemutani Naomi.
Absent.
Honorable Olivia Koskei.
Absent.
Honorable Vincent Mutai.
Absent.
Honorable Victor Rob.
Absent.
Honorable Chepkirui Felode. Honorable Catherine Chamngatich. Honorable Lily Cherotich.
Let us have the tally.
Mr. Speaker, no are 4.
Huh? How many?
There are 4. Those who voted nay, are 4.
And abstain is 1. Okay.
Mr. Speaker, those who voted yes are 14.
They are what? 14. Thank you very much.
Those who want to go home.
I want to congratulate the IEBC. They've done a good job. Of course, initially I could not get clearly. Apparently, 4 voices seemed like the all outs. So I could not get clearly which side was the majority. However, through the division bell and the division process that has gone on, we had 1 person abstaining. 4 members voted no, and 14 members voted yes. And therefore, the ayes have it. Thank you very much. Before we proceed, honorable members, I've decided that, and with the guidance from my team here, you will continue with your committee meetings until 19th of December. In between, should the need arise, right from the chair, the finance, and also we might need to combine both reports from appointments committee and the finance committee and any other committee that has anything to bring to the House. We finish that business any day before we close the year. So I want to urge the members, when called upon to sign for the special sitting in the near future, kindly sign so that we can have that date. But we will all agree that the business we will come and undertake is for the benefit of our county, so we can proceed, all of us. Otherwise, I know we are proceeding for the long recess, and there's a lot. For the initiates who are still undergoing the initiation process, we want to wish them the very best. Members who have children, I know of Honorable Eric, Honorable Karen, I don't know, Olivia or who? Yes. I know, even you, Honorable Evelyn. Oh, so we want to wish them the very best. You can also invite us when you will be receiving them at your homes. We will gladly come, especially during this period. Also, the pupils who are in primary and those who are in high school who cleared Form 4, we want to wish them the very best as they are at home. May they enjoy the holidays. I don't know when we'll meet again, but I want to wish them the very best this time as we proceed. Thank you very much. So, honorable members, this sitting is adjourned up to 11th February 2025 at 2:30 p.m. Thank you. I believe we'll meet before Christmas. So we'll wish each other Christmas and Happy New Year when we meet again, once the Chair Finance and the other committee have met. For now, wishing you the very best. Those who are in hospital or not feeling well, we want to wish them quick recovery while there. One of our staff lost a parent, and we condole with the family especially during this sad period. Thank you.